before we move on?
Raju garu, are you there?
Hello, can you hear me, Andy?
Yes, if you could turn on the video so that we can see your handsome face, just like Lucas.
1 second, sir. Good afternoon, everyone. Thank you, Suresh Garu. And this is a second successful program from vStrive and TUTA combination last 1 year. And as Rajiv Garu said that he did this kind of programs in masters. And these kids learning in high school level, it's a great opportunity through Suresh Garu. It's a wonderful program. I don't know how many kids will believe you like Acharya. This is, we can say that you're definitely Acharya for this generation kids. And it's wonderful opportunity for them to learn. Actually, I'm talking to, before the Blue Belt program, I'm talking to one of our colleagues in TUTA, Deepika Male. She said, why can't we join? And some of the engineers, we didn't get opportunity to do this kind of programs in our curriculum or in our, even we started career last 20 years. We never get this kind of opportunity actually. Thank you so much, Suresh Garu, and vStrive and TUTA will continue like this. And kids, good luck. And don't forget this kind of opportunities, what Suresh Garu and TUTA is giving. And come up in and do this kind of programs like, always remember Suresh Garu and vStrive and TUTA. Thank you, sir. Thank you. Good luck for the kids.
Yeah. So can I make a request? Mr. Rajiv, could you please turn on your video so that we have the opportunity to put a face to the name? Thank you.
Yeah.
Thank you.
I was doing something else, so just try to jump in and congratulate the team.
Yeah.
Thanks, Suresh Garu, for your effort.
Yeah. So before jumping in, I do want to say a couple things, and then we'll jump into the presentation. I promise I will keep it short, less than 10 minutes. No, I'm kidding. I'll keep it to a minute or so. So first of all, I would like to welcome all of you to the project presentation sessions, which is your last leg that you would hopefully successfully complete today before we issue the certification. And hopefully all of you will receive the Lean Six Sigma Blue Belt certifications, and wish you all the luck in that. And with that, I would like to welcome you to the vStrive program in partnership with TUTA. And this is the third wave actually that we are doing. So there's only a few people that got certified as Blue Belts through vStrive, and you're one among the elite of that as we've progressed through the project presentations today. The second aspect is I would like to thank Mr. Raju, Mr. Ishwar, Mr. Rajiv, and Mr. Shiva, and above all, Mr. Srinivas for his dedication to help with the logistics and running this program. Thank you for being there every hour, every minute, Srinivas. It was a lovely partnership to be able to do that. And finally, coming to my buddy, Lucas, who will be the judge for today's session. Just to give a little bit of a background on him. He is from the oil industry. He has a wide experience in the oil industry. He's worked for Chevron, ExxonMobil, so on and so forth. And I had the chance of working with him at ABB. We both were called as two peas in a pod. We were tag teaming on a lot of efforts, and Lean Six Sigma was what we lived by and practiced by completely throughout our careers at ABB. And Lucas brings about 25 plus years of experience in Lean Six Sigma, continuous improvement, change management, and so on and so forth. He ran his own consulting firm in the area of Lean Six Sigma. So I couldn't find a better judge than him. And he has graciously accepted to give us 3 hours of his time today, even though he had a lot of other scheduled activities, and he had to move those to be here. So I really want to appreciate Lucas for giving us the time and bringing his expertise to be able to evaluate your projects today. He said, should I go easy or should I go as usual? And I said, go as usual. So please put your best foot forward and let's take it forward. Before that, any questions? And I forgot to mention Ajay. Thank you, Ajay. My apologies. Didn't mean to omit your name, actually. So my apologies. Thank you, Ajay. For
Thank you very much, Suresh.
so any questions before we move forward? Okay, good. If not, if no questions, I would request who would want to go first? Which team?
We would like to go first. We would like to go first.
Who is that?
I'm Vishwa, the COVID-19 group.
Okay, and Ananya, you were saying, oh, both of you are the same.
Yeah, we're both in the same group.
Okay, and why the urgency?
Because
you guys are not dropping. You guys have to stay for the entire.
Yeah, we know.
Yeah,
Just
we know.
like
Okay.
to go first because
Okay, so one thing what I would request is Lucas is going to be grading you guys on the presentation. And if, Lucas, do you want to say something in terms of your approach and your style and what you're looking for?
Sure. So thanks for the introduction, Suresh. Basically, and I've been doing this for a long time. I've probably mentored well over 200 people. Some of them not as young as you, but fresh out of college. So I've been doing this, as Suresh says, quite a long time. So I'm basically going to be looking for you just to follow the prescribed methodology. This is Lean Six Sigma, has certain steps that need to be taken, and it's a pretty standardized approach. So I'm just going to be, I have the criteria here, which is Suresh's or somebody's created, which follows the the standards pretty well. So I'm going to be looking for you to show evidence that you follow the standards either through your presentations or the questions that I'm going to ask you.
Thanks, Lucas. So with that, we'll pass on to the team to be able to present. Hopefully you have the ball. And what I would request is for the admins to change the video to whoever is speaking. That way, when people speak, their video is coming up actually.
So Ajay, are you there?
Yes.
Yeah, Ajay can take care of it. Yeah, we can go ahead.
Okay. So I would pass it on to the team, Vishwa, Ananya, Sriharsha, Baran, and I'm missing one other person, but please take it over.
All should get unmute. Vishwa.
Ananya, Sriharsha, Baran, and there is one other individual.
Messi.
I just unmuted Vishwa. You should be able to talk.
Can everyone hear me?
Bharan is unmuted.
can we go ahead and start?
Please do. You have 15 minutes.
Okay. Hi, my name is Smriti Muthakrishnan.
Hi, my name is Ananya Yanduri.
I'm Sriharsha Jaladi.
Hi, I'm Baran Narvula.
Hi, I'm Vishwa Karapati.
And we are going to be presenting on how to reduce COVID-19 cases in Wake County.
So starting off, we're going to start off with the define phase. So as we go on, we're going to, so in the beginning, we're going to talk about the Gantt chart. So as you see it, we have different roles and responsibilities in the define phase, which we have split among ourselves. And we had specific due dates in which we had to achieve these responsibilities and complete them by in order to have the project done on time. And so moving on, the problem and goal statement in the primary metric. So the problem statement that we had was that as of May 1st, the COVID-19 cases have increased by 81% in the span of 3 months. So thus we were having the potential for residents to catch the COVID-19. So this includes a fear factor in all residents. So our goal statement, which was to pretty much reduce the average number of COVID-19 cases by 25% in the next month, starting at the date of August 30th. And our primary metric was the number of cumulative COVID-19 cases per week. And our data was collected from the range of May 1st to July 31st. And so going on, we have the stakeholder analysis now. So the first 5 stakeholders are the team members, and coming to which are already on this call. And the last person is our COVID-19 contact. So pretty much this person her name is Amy, and she's the Wake County government COVID-19 data collection and correspondent person. So if you have any questions related to COVID-19 or anything else, you would reach out to her. And so we reached out to her, and she helped us she responded back at one point and gave us our data collection help, but we could not be able to get into contact with her after that. And so next we have the SIPOC chart. So we have
Can I ask you a question?
Yes.
Can I ask you a question? Just, I think I know what you're measuring. Are you measuring people that have actually tested positive when you say cases? How do you define cases? Just so I'm clear.
Yes. So cases would be people who've tested positive from the COVID-19.
In Wake County.
In Wake County specifically.
Go ahead. And, go back to your stakeholder list one more time real quick. Yeah, who are, so you mentioned somebody in Wake County.
Yes, that's
who are all these other people? Who are all these other people?
The first 5 people are the people in the team members. So the 5 team members that are present in this Zoom call that are going to be presenting the project with me as well, including myself.
Now I see your names. Okay.
Yeah.
All right. And then the last person is the Wake County.
The representative, the correspondent person that we reached out to for data collection help.
What do you base the power? Can you define what you mean by the power?
Well, so power as in how many, so in the whole project, who had the most, had equal power, or as well as how we controlled how the situation went about. So since us 5 were the people who were running the project, we had the most power since we knew how things were going. And stakeholder 6, as you can see, it's a 30% power. So 30% power is showing or giving them out saying that she was only looked towards for the data collection help, but she wasn't there for the analysis and so on and so forth.
Okay. Thank you. Go ahead.
So continuing on with the SIPOC analysis. So we had multiple charts for the SIPOC, and we had multiple different processes that we went by. So the first process that we went by was the COVID-19 could occur to anyone, that anyone could get the case. So the suppliers for this would be any place or anyone you would know that you could be exposed to COVID-19, and then how we're going to send out masks to them. And so the inputs would be the Wake County residents. Our outputs would be the positive and negative cases for the residents. And our customers would be anyone who was exposed to the virus. So that's one of the processes. And then moving on, we have 2 other processes here, which is top one is COVID-19 testing. So the suppliers for this one would be doctors and pharmacies. And the inputs would be person getting tested, since you're getting tested to see if you're going to be positive or negative. And our output would be positive or negative to see if you have COVID-19 or not. And our customers would be the people who seem to have the symptoms, who've been exposed with COVID-19, so on and so forth. And so the next process is safety precautions. So the suppliers for this one would be the CDC or doctors. And the inputs would be precaution lists from WHO or the CDC or doctors. And our output would be same as the previous one, which are positive or negative if they have the case or not. And the customers would be the people of Wake County, and as well as our team members, which are the people in the presentation along with me. And our last
question for you guys on this. So the processes are the ones that you're listing a lot of good processes here. They're the ones that generally that you want to make improvements to, right? That's why,
Yes.
that's what this is all about, is making change to processes so they're better than they currently are today, right? So the one that you have on testing, is that a process you plan to change?
Yes, because there is right now the process that is being used for testing is not as efficient because testing kits were unavailable at one point or another, and the testing wasn't available for every single person to get tested. It was just if it was a priority based testing. So if you didn't if you only utmost needed the test, you were to go to take the test. But now we're trying to make it available so that if you feel that you have the slightest symptoms, then you can go get a test. Otherwise, it's just going to be it. Before it was like if you have the slightest symptoms, then it might be a waste of a test if it comes out negative.
And just to add on to that, we want to spread more awareness for people to get tested. So like they know that they need to get tested if they're not social distancing.
If you, and that's a good idea. It really is. Did you ever think that if you improve the testing process, that your numbers will go up and it'll be, it affects your metric?
It could, but also this isn't the only thing that's affecting the COVID-19 cases. So if people were to actually social distance and wear masks and take the right precautions, they wouldn't need to get tested in the first place because they wouldn't be having the symptoms. They wouldn't, and even if they get tested, they would have negatives. The test would turn out to be negative since they are following the right precautions in order to be safe.
Yeah, right. Yeah. When you did this, that's what I thought you would go after, the like a safety precautions process and
yes,
and those kind of things. So there's nothing wrong with what you're doing. They're both relevant. One is improving the measurement, and one is reducing the frequency of getting the case. So they're slightly different, but you can approach it both ways. Go ahead.
So, and then our last and final SciPloc chart that we have is the COVID-19 vaccines. So the suppliers would be companies that would be making the vaccines, such as Moderna. And so the input would be research data from the companies or from other outside sources, as well as news feeds who are taking the data in of who is implementing the correct vaccine for COVID-19. And so outputs would be, is there a right vaccine that is curing COVID-19 right now or preventing COVID-19? And so our customers would be Wake County residents. And so moving on, that would be, and I'm going to give a little quick summary of what I've discussed in the define phase. So pretty much our main problem was that the number of cases in COVID-19 have gone up by 81% in the last 33 months. And so our main and outlying goal was to reduce the number of cases by 25%. And we achieved 100% of the buy-in from all 5 of the team members who were presenting along with me. So that's all. And I would like to pass the presentation over to Ananya to carry on with the measure phase.
Hi, my name is Ananya, and I'm going to present the measure phase.
Ananya, can I maybe interject? In the define phase, more of a question for Baran.
Yes.
What happened to the potential benefits and the potential obstacles? Did you guys give some thought to it?
Okay, so potential benefits, the benefits, we included them. It's just, they're just later on in the improve phase as well. But the benefits, just if we implemented our processes,
it's okay. We'll get to that in the improve phase as long as you guys are covering that.
Yeah,
okay.
yeah. They're covered in the improve phase at the end.
Okay. And what about potential obstacles?
Obstacles as well. They are leading into the benefits, but obstacles would just be, in this case, I guess, competition between different companies for the process for vaccine, competition between the companies on who is establishing which vaccine and which one is like more valid or like credible than the other one. And then for the COVID-19 testing, I guess obstacles could be just something that could the testing kits be prepared for everyone? Could they be
So,
passed out in time,
Bharan,
and so on and so forth?
And Lucas, please chime in. But the potential obstacles that we are looking for at this stage is, what are you guys as a team going to face in executing this particular project?
One obstacle that we did consider is if we didn't have enough money for any project or thing that we wanted to do, there was always an obstacle of money. For example, if we wanted to have a seminar, we might not have the necessary money to, rent an arena, rent chairs, anything like that. Or if we wanted to host a campaign, we might not have the money to make flyers and post them around. Another obstacle that we might do is, because we're in high school, we might not have enough time to place into this. But we decided that if this were to be something that we wanted to do, we would make the necessary time.
Okay.
And continuing on with our presentation, this is the measure phase Gantt chart showing who's responsible for what thing. This is a process map showing the day in a life of someone in COVID-19. And the things that are included in this are activities that a person would do, the potential of catching COVID-19, and how they could catch COVID-19. So to go over the high potentials, playing contact sports would be one of the high potentials of catching COVID-19. And it would obviously be because they're having a lot of physical interaction. Going shopping could be one because they come into multiple, there's a lot of people at shopping places, and they could become, there could be multiple infected people. Hanging out with friends, there's probably more than one friend, and it would be a high chance. And going to parties at someone's house, there's a lot of close proximity, so we could also spread at someone's house. This is our data collection plan, and it shows our data elements, so COVID cases per week in Wake County and in each city or town. It shows our KPOB and KPIV, the data type, where we got our data, how we got it, and who found it, how much data, how long, and our sample size. These are some graphics, and links to our actual data. So this is our actual data.
So what does F stand for on the previous slide?
F stands for Wake County's response to COVID-19.
So every single county for all the counties in the US are graded from A to F, F being the lowest and A being the highest. So Wake County is at an F, which means they are very poor at social distancing, and you can see for less than 25% reduction in average mobility, etc.
Okay.
So this is our actual data used, and the data we used was, although it's mistyped on top underneath, in the actual graph it is typed properly. The way that we made our data is we added all of the data of a certain week, and that made our data point. So for the example of the week of May 3rd, we added all of the data points of all the days in the week of May 3rd to get our data point. And at the bottom of the graph, while it may seem that the data is becoming normal, immediately after that, the cases went up. So this is our MSA/audit, and we did a physical audit. And the way we did our audit is we took 6 different data points from our data set, and we discussed them as a team and to make our trust level. Because the data was so out of control, there were no real outliers. So it was pretty easy to see if something was trustful or not. And the way we did our audit is we compared our actual data to multiple sources, such as the data from our actual source and the news feed of the data at the day. So if the data from May 3rd seemed a bit out of proportion, we would have cross-checked it with data from other resources at May 3rd. But everything seemed good, so we put trust levels for green in all of our data points.
Go back one before that, but I want to see those two again, because the data ones, you went a little bit fast. Okay, so that's the same data that you have on the next page, right?
Yep, it's just multiple. It's just 6 points instead of the 11.
You mentioned something about outliers. Are you going to talk about that more?
Oh, what I was trying to say is that there were no outliers when we did our audit.
I know.
Huh?
How do you know if it's how do you guys know if if a point's an outlier or not?
We did multiple charts that are shown after this, but
okay.
One of the ways that we did it is we went through the flow as a team, and we concluded that there might not be outliers. And that was just an inference at the time, but after we did our charts, it was confirmed.
You have a chart that actually shows a point as outlier. Okay, go ahead.
So this is our normality test, and it may seem that the data is normal, but this is only due to the cumulative data points. And if it wasn't the cumulative data points, it was vastly abnormal, and it was completely hard to work with. So the reason that we're using cumulative data points is that it allows us for a normal data set, and it would be easier to work with. And that's the only reason we were using cumulative data points. This is our IMR chart, and it shows how stable our data is. And to interpret this, the bottom 4 red data points are data points that we're not going to mention, or we're not going to take focus in. And that's mainly because we want the cases to be as low as possible. And if they're low, we shouldn't pay attention to it because that's a good thing. The upper spec ones, the 3 red dots over here, are points we want to focus on because they're going above our upper spec limit. So this is our process capability, and the way that we decided to use an upper spec limit. And the way we made our upper spec limit is we used the mean of the data points, and we subtracted it by 25% of the mean because we want to get rid of 25. We want to decrease 25%. So the interpretation of this is because our CPK is in the negatives, it shows that the process is incapable, and it has the possibility of showing dramatically different results. And our ppm value is 648,250. This means that 65% of the time, the values will go past our USL, and that's concerning because we don't want the data points to go past the USL. And our CPK and PPK, for our CPK, it's negative 0.55, and our PPK is negative 0.13. And this is because, and the PPK is lower because over time, the data becomes more spread. Our summary of the measure phase is that the data is normal, but it's only due to the cumulative cases. The process is not stable, the process is not capable, and this basically means that it's incredibly hard to predict, which makes the situation worse. This means that the cases could go from one point to another very drastically in the future, thus fueling the reason to help reduce cases. And now I'm going to pass it on to Smriti for the analyze phase.
Let me ask you one question from that. So I like that. I like your comments. I think you're right that it's, unstable process is difficult to predict. And that's a key point. Would your team or any of the stakeholders or anybody that associated with this would be able to identify those reasons that the process is out of control, those last few points that were really high, right? So that's unstable. It's as you said, but what's the advantage of being able to figure that out if you can?
If we were able to figure out why those points are above, we would try to slow those. We would try to get rid of those reasons completely. That way, the only way the data could go is more down. So for example, if one of the reasons that the cases were going up or that people weren't wearing masks because they simply thought that it wasn't going to do anything. So if we create awareness about why masks are important and what they do, more people will wear them, thus decreasing the rate of infecting.
Yeah, well, that's exactly right. I mean, that's the reason that you want to identify those special cases. Oftentimes they're more apparent, and you can fix and you can figure out what they are because they're different, they're special. They're extraordinarily, they're set apart from the normal causes, right? I was just wondering if you you guys have any idea of what could have caused that?
In case of that, these points happened at the end of July, right? The points there, and that's once people started most people started just going out, right? They didn't care about wearing masks or wearing gloves or anything like that because of quarantine starting in March. By the time it was July, people were absolutely done with it.
Okay, that makes a lot of sense. Yeah, that's good analysis. Okay, all right,
And
good job.
to add on to that, lockdown measures were also lifted, so people started going out more.
And now I'm going to hand it over to Smriti for the analyze phase.
So I will be taking over the analyze phase. First, we have our Gantt chart, which again shows how we split all our work in the due dates. Next, we have our waste chart. So here you can see that the defects, some of the basic defects of having higher cases is people not wearing masks, not quarantining, not having enough test materials, equipment, they're not getting tested, and even that there aren't enough healthcare workers to help patients who are tested positive for COVID-19. And then waiting, so since there is a limited amount of testing kits, people are gonna have to wait longer to get tested, and if they do get tested, results take at least 1 to 3 days to come in generally, and then not fully utilizing people. So there might not be enough healthcare workers, or there are too many healthcare workers and some of them are not being utilized in hospitals. And then we have transportation, so testing kits, this starts at the manufacturing site, so like testing kits, masks, sanitizers, they might not be transported fast enough for the places that are highly infected. And then we have excess processing. So some people might go out more often and they might get tested more than once, which is excess processing and wasting testing kits for other people.
All right, that's got a question on that. So when you do an analysis of waste, you're doing it on one of the processes that you're analyzing, right? And I think you guys showed 3. You showed the testing, you showed the, I guess, getting the safety, getting prepared before you go out, or whatever you want to call that. And then the other one was the process of coming up with vaccines. Which process did you analyze?
So, okay, this waste chart is kind of like focused on all of the SIPOC aspects that we said, because if we're specifically talking about safety precautions, for example, well, the defects would be people not taking those safety precautions, like not wearing masks, not quarantining, and things like that. So we kind of did a combination of all 3 SIPOCs in the chart.
It seems like it's more focused on the, when the safety precautions, I think, when you're going out, but okay.
So next we have our fishbone diagram. Here you can see that starting with machines, transportation vehicles, and manufacturing sites. So this having slow manufacturing and slow transportation gives limited PPE, limited mask, testing kits, hand sanitizer, and gloves to the people and cities that are highly affected. And then for process and methods, so some processes and methods like not wearing masks, not shutting down all activities, not stopping international travel can also increase the effect of COVID cases rising. And then for the environment, so we have people who go to crowded cities, who travel, and these people may not be wearing masks, or they're just sick and they don't know it. And so this could also affect the rising cases. And so we put all of these points in our C&E metrics on the next slide. And so as you can see, a majority of the key points from the fishbone diagram are high impact and high probability. The highest ones are related to masks and not social distancing. So for masks specifically, we have people who are not carrying masks outside, not buying masks, or wearing defective masks. And then for social distancing, we have people who are going out for work, business purposes, groceries, public places for leisure, and going out to crowded areas. And so here we have our 5 whys. So based on the key focus variables from the last slide, we made the 5 why diagrams. So for specifically masks, people don't wear masks because they tend to forget it and it's not handy with them. And then people who don't buy masks, some of them don't believe that wearing masks actually have an impact. And this comes from not having the proper awareness of the impact that masks have on COVID cases. And then people have defective masks. So some people might be wearing the same mask several times, causing it to tear. It could be a defect from the manufacturing site or shipping. And so going on into the people have tears in their mask, they probably don't have a bulk amount of mask because they don't feel like they need that. And that also ties in with awareness. And then people who go outside, so they might need groceries, and the main reason that they go out several times is because they don't buy bulk in the beginning. People who go out for work or business, so typically they want to be financially stable and help support their family, so they go out regardless of the pandemic. And then people who go out for leisure, they're just tired at this point for quarantining, and lockdown measures are lifted, so they think it's a green light to go outside. And lockdown measures were lifted because of economic purposes.
I got a question for you. All right. So go back to your cause and effect for a second. No, the
Fishbone diagram?
The fishbone, sorry. Yeah. How did you, so these are what you call potential causes. So you're brainstorming, coming up with ideas on what could be causing the cases to go up, right?
Mm-hmm.
How do you decide which ones you're doing of these that you're doing the 5 whys on the root cause?
We sat down as a group, and we also used internet sources and the rising cases, as well as taking a survey later on. And so with all the surveys, us talking about all the variables and the internet, we came up with the ones that have the most impact on rising cases.
Good. And that's exactly what you should do. You should, not all those are going to be causes of your problem. Typically, you'll find there's only a few, sometimes 1 or 2 or 3 at most. Mm-hmm. And those are the ones that you want to dig in and do the 5 whys, because those are the only ones that are going to matter. You might have 20 up there, but I've never seen more than 2 or 3 that actually relate to a cause of a problem. So, good job.
And then going on to the next slide. Okay, so here we have our one proportion test. So we took a sample data of how many cases were in each city or town of Wake County, and we compared it with the mean average minus the 25%, because we want to decrease 25% of the number of cases. And here you can see only 2 of them are actually above the p-value. The rest are below the p-value, so the null goes. And there are more cities and towns on the next slide. So looking at these, we ordered the p-values from least to greatest, and also the percent infected in each city or town based on their overall population. And so looking at the cities and towns with the lowest p-values and comparing the data of how many percents affected, we came up with the cities and towns to target in order. So the first 3 that we mainly want to focus on is Knightdale, Zebulon, and Gardner.
What question are you trying to answer with this analysis?
So the question we're basically trying to do with this analysis is to see like the correlation between COVID cases and more populated cities. Like typically, so if we go into the next slide, actually, we have a scatter plot. And so as you can see in the scatter plot, you can see all the cities and how they correlate with each other. And Raleigh and Cary have the highest number of cases, and they're the most populated cities in Wake County. And so basically more populated cities means that there's more cases. But then when we divided it by the number of populations, there weren't as many people affected as there were with the cities with lower p-values.
Can you go back to the p-value, the very first one? I just want to look at it now that I understand what you're doing. Okay, you got a p-value. Okay, and go to the next one then. And in the next one. And then the percent affected in each city, that's the cases?
Yeah, so we took the number of cases in that city or town and divided it by the entire population to see what percent of the people in the population is affected.
Okay, And then go ahead.
And so to summarize this entire phase, so the main causes of COVID-19 cases are people not wearing masks, having defective masks, and not following social distancing orders. The top 3 towns or cities to target are Knightdale, Zebulon, and Garner, as they have a lower p-value than 0.05 and have the highest percentage of people infected in their population.
Can you guys try to wrap it up in the next 3 to 5 minutes, please? Because we went over a little bit.
And now Sri Harsha with the improved phase.
Okay, I'm Sri Harsha, and I'll be presenting the improved phase. Next slide. So this is the other slide. Okay, so this is the Gantt chart for the improved phase, and it just shows which part we did and who did what. Next slide, please. This is our improvement plan. Our cause is COVID-19 infections. And our first point is that the CDC has said that the top reasons for the rise in COVID-19 cases is lack of social distancing, refusal to wear masks, and not staying home as much as possible. Our plan was to make a survey and ask people what they thought of the pandemic. This way we could get a good expectation of what the customer thinks. So we made a survey that we sent to 100 people through social media and asking our friends to share it with people they know. And we got it sent to 100 people, and we got 83 responses. So we had a response rate of 83%. And down there in the pie chart, the blue section represents the people who actually filled out and submitted the survey, and the red part is the people who got the form but didn't fill it out. Next slide. This is our first survey question, and it was, what do you think are some solutions for the COVID-19 pandemic? This was a type of question where we had 5 solutions, and they could pick whichever ones they felt were needed. And as you can see, the most picked options were wearing a mask and avoiding largely populated places at 92.8% and 91.6% respectively. Next slide, please. This was our second question, and it was, do you know that the cases are going up every day? And based on the pie chart, 95% of the respondents answered yes, which is a good sign because they're aware of what's going on. And this was our final question in the survey, which asked the respondents if they were comfortable with cities reopening. And this was an open-ended question. So out of the 83 respondents, 80 of them said that they were either scared or uncomfortable with cities reopening. We had 2 respondents say that they had mixed feelings and they didn't really care what happened. And we had 1 respondent who said that he or she felt good about cities reopening. And our survey solutions were that 64 respondents chose all 5 options that we provided, which were social distancing, wearing a mask, avoiding largely populated places, staying home as much as possible, and having a mask with you everywhere you go. And 15 respondents chose the 2 choices of wearing a mask and social distancing. 2 respondents chose the 1 option of staying home as much as possible, and 2 respondents chose the one option of wearing a mask. The summary for our survey is that 77% of all respondents chose all 5 solutions, and 23% of all respondents did not choose all 5 solutions. This is a bit concerning because almost 25% of the respondents didn't think that all 5 solutions are necessary or good solutions to slow down the spread of the coronavirus.
Did this survey, did you provide them with stuff? So in order to come up with solutions, you have to address the causes of the problem, right? So did you provide them the analysis you did to help to come up with solutions?
Yes, we on our survey, we stated some of the CDC and World Health Organization guidelines and causes for why it's spiking, so they were well informed before they answered the question. And these are some CDC / World Health Organization solutions and customer solutions as well. According to CDC and WHO, clean and disinfect commonly touched surfaces using bleaches and sanitizers. Always wear masks when coming into contact with people. Wash your hands thoroughly with soap for 20 seconds if you touch any surfaces that are commonly touched. Cover your coughs and sneezes. Practice social distancing. Avoid touching your face and stay home if possible. And our customer solutions were wearing a mask, social distancing, staying home as much as possible, and avoiding largely populated areas. Next slide, please. And this is our improved process map. As you can see, I'll only go over one of the processes. So basically we start with someone quarantining, and then the next one goes if they go outside, and then they check their checklist, which we suggest that they do so to make sure that they have all the precautions in place. And then they have everything. And as a result, this reduces their risk of contracting the coronavirus. Next slide, please. And then our implementation plan. Our implementation date for our solution was August 30th, 2020. And our plan is to have mass encouragement of social distancing, staying home, and wearing a mask. And how we plan to do that is we're going to have campaigns, and we make flyers that we send out to the public. Our next point was to raise awareness, to encourage people by making graphics and then posting them through social media. And then we plan on sharing graphics with people to encourage safe practices. And these graphics would spread awareness for the issue and encourage good habits. Next slide, please. This is our problem solution chart. We'll only go over one. And if one of the problems was that you're forgetting a mask, the solution would be to have a checklist pinned to your car or to your door so that you can refer to it anytime before going out. And the checklist would include key items to have, such as masks, sanitizer, disinfectant sprays, etc. And this is just an example of a graphic that encourages the use of a mask. And then this is another graphic that encourages people to make a checklist. Next slide, please. And this is the summary of our improved phase. So all in all, a lot of the typical solutions that were chosen were social distancing, wearing a mask, staying home as much as possible, avoiding largely populated places, and having a mask with you everywhere you go. And we would have campaigns to encourage these behaviors in order to educate Wake County residents. And with that, I want to pass it off to Vishwa.
Thank you, Shriyosha. This is a control phase Gantt chart, and these are the people that are responsible for each component. And the control plan is, we had improvements, and we'd see like the sustaining mechanism of each improvement, which was the likelihood. And our first improvement, for example, was wearing a mask. And for the sustaining mechanism, we said making a checklist, maybe having a checklist in your car so you could see if you're wearing a mask while going outside. And likelihood of that would be 3. And then another one would be social distancing, trying to stay 6 feet away. And many people know the health benefits of that because you won't catch COVID-19 if you have a reasonable distance between you and another person if you don't come into contact. And the likelihood of that statement would be 4. So those are some examples. Next one. And some benefits, if the cases were to be reduced and all of our precautions were taken and COVID-19 cases were to go down, school students would be able to go to school, and more stores and small businesses would reopen, provide jobs for other people that have been lost during this time, so then unemployment rates would go down, and primary and secondary businesses would be both able to open back without having any restrictions and be a free process. And if cases were to be reduced, financial benefits would be the economy would stabilize, such as businesses opening and giving jobs to many people that have been losing them. And sports would resume for non-financial, because many people, as I've known, been waiting for professional sports and their own sports to open up. And maintaining our improvements. So these are the improvements we tried to build and have the best shot at decreasing COVID-19 cases. And to maintain them, we'll be performing many campaigns in order to spread awareness to everyone and keep it fresh in their minds. So we would do that by making social media posts and spreading it through the internet so people see it everywhere they go, because this generation has been involved in social media. And also campaigns in person, which would be safely done. We would put it far away from the door where they could see it, or signs in local areas where everyone will go to. And this is an example of our social media post. And this is an Instagram page, and we call it Wake County COVID. So creating flyers or creating pamphlets so everyone could see. And we thank you all for listening to our presentation. Thank you all once again.
Thank you.
Thank you.
Can we go second?
Thank you, guys.
Lucas, any final comments on that?
Yeah, I do. Overall, that was very good. You picked a good project to work on. You had good data that you collected, and the analysis was good. I was very impressed with your analysis, both on the data side and the causes, and the solutions tied very well to the causes. One thing that the biggest problem you guys, if you are actually trying to do this project, is what's called world hunger. You're trying to fix everything. You're trying to fix the testing, you're trying to get new vaccines, and you're trying to change improve the process of how people go out and be safe when they're interacting. Just do one thing. You can't fix everything. All your solutions were all related to the last one, going out and taking safety precautions. So I would have just skipped those other two SIPOCs that you talked about and just focused on one thing, because all of them are hard. All of them are difficult, and you can't fix everything with one project.
So Lucas, I have a question for you. If you were the governor of North Carolina state, would you hire this team to solve the COVID-19 case?
Yes, I would.
Okay.
They're super sharp.
Okay.
They're good. Better than some of the engineers I've worked with at Chevron. Last comment. Make the presentations too long. If you're given a certain amount of time, figure out how many slides you need. Typically, you're going to talk about 3 minutes per slide. Okay. You guys had a lot of slides that were kind of repetitive, and you went through them so fast. I'm pretty slow, so I need time to look at it and analyze it. So, 7, 8 slides probably would have been fine. And then just spend a little bit more time on them. Overall, fantastic. Very impressed.
Thank you. Thank you.
Good job, guys.
Thank you.
Team.
Oh, can we go second?
That's Shreya.
Yeah.
Okay.
Good afternoon, everyone. Our project is about the pet adoptions at the local.
Can you please move closer to the microphone? Your voice is barely audible.
Can you hear me now?
Still the same issue.
Okay. Just a sec. Can you hear me now?
It's the same issue, but continue.
Good afternoon, everyone. Our project is about the pet adoptions at the local Wake County Animal Shelter. The group members are Shruti, Vinita, Shreya, and Wishwant.
So first we have our define phase. Next. So our problem statement. So since January of 2017 through May of 2020, the monthly average for pet adoptions was 42.3. So hence, if pets don't get adopted by a certain period of time, they're going to get killed. For our goal statement that we want to increase the monthly average adoption rate from 42.3% to 60.8% by the end of August of this year.
So why did we choose this project? We chose it because usually people think pets from Wake County Animal Shelter are defected just because they have multiple skin colors. And also, in some cases, they might have disabilities and diseases, but that's not in every case. And also, one other factor is when pets stay at the shelter for a long period of time, the shelter runs out of space. So they try to kill the existing pets in order to bring in new pets. And that's not really ethical of humans to do it, to kill the pets. So that's why we're trying to increase the pet adoption so we can maintain human standards.
So for stakeholder analysis, me and my
Vishwant, we can't hear you.
Teammates thought that our impact would be that fewer animals would be killed and that more animals would be adopted. And our
I can't hear you.
Between 8 and 9 out of 10, and our influence was 8 out of 10. And our goal was to increase adoption rate between 50 to 55%.
I can hear you. Okay. Can you go back to that? Can you go back to that just real quick? Okay. All right. Okay.
So our primary matrix was monthly adoptions at the local animal shelter.
So this was our Gantt chart. So pretty much it was kind of half and half. So half of it was done by the team, while half of it was done by one of us. No.
Is somebody talking?
I think you're on mute.
Okay, sorry about that. So basically the process to adopt an animal at the shelter is you have to go to the shelter first. You decide on an animal that you're interested in. You get to have like an interview or like spend some time with the animal. So you know it's like the right animal for you. Then you get to submit an application and then you go through an interview with a pet shelter employee and they basically ask you some questions like, why did you choose this animal? Why did you choose our shelter? And questions like that. And then after that, your application gets accepted and you pay for the pet. And then after that, the shelter checks the pet to make sure it's good and up to date on everything.
So the suppliers is the adoption center. Our inputs are an application you have to fill out and an interview with the pet in the shelter and the time it takes to get the pet. And our outputs were to get the pets, the pets would go home. The pets would also get fostered. And our customers were the person adopting the pet and the pet.
Yes, is this the end of, go back to that. Let's talk about the process. So if you want to increase adoptions, there's probably several ways you can go about it. And now that you guys are talking through this, so what you guys are going to do, you're going to look at the process from when somebody submits an application, goes to the shelter, checks out the pet, and there's something you're going to be able to do differently in those steps there, right? Is that what you're saying?
Yes.
Okay. All right. I just want to make sure I understand it. That sounds like an appropriate process to look at. Good.
So now we're going on to the measure phase. So this was the data collection plan that we were ideally like what we wanted to go by. Unfortunately, it didn't go as planned, but we still got the data. So the only thing that changed is instead of calling, we found it on their website. And instead of one person doing like getting the data and collecting it, we decided as a team to do it. So the whole team did it together and we collected our data. And we got the data done by a few days after the due date. So we got it done by the 11th instead of the 8th.
You actually have the numbers on those?
Of the data, yes, it's in the next slide. So the first page leads to the page of where we got our data from.
We can't see the data. We can't see that page, whatever you might have opened up.
Okay, Vinita, can you click on it, please? So below here, it has all the data that we collected, and we collected from January of 2017 to May of 2020, because at that time, that's all they updated. And the second link leads to where we had a spreadsheet to store our data. And we had 3 rows and 3 columns. So we had the year, the incoming, the adoption, the transfer, and the youth. And then we had it for 3 animals. So we had it for the dogs, cats, and other animals that they have.
If you guys are playing YouTube and this one at the same time, looks like there is some voiceover. So you guys might want to turn off the YouTube while you're presenting.
Yeah, I don't have YouTube on.
Okay.
So this is our data collection plan. Oh, sorry. This is a graphical summary for number of adoptions. Our mean, our p-value is 0.355. Our mean is 314.34. Our standard deviation is 93.56. And our confidence level for mean is between 284.81 and 343.87.
So
getting to it. Go ahead. Go ahead.
Okay, sorry about that.
So
for the normality test, the data is.
There are 2 sources of whatever it is. There is a lot of a voiceover, Jyoti. While you're speaking, there is a second voice that is also coming from your microphone.
Is it better now?
Yeah, thank you.
Okay. So now for the normality test. So the data is on or near a straight line. The p-value is 0.355. And if the p-value is more than 0.05, the null is not rejected. Hence, it means that the data is normal.
This is our stability test. So looks like our data has passed the test for most of the time, except for points at 8, 20, 32, 40, and 41. At points 8, 20, and 32, our data was above the UCL, which is okay because we want more pets to be adopted. But at points 40 and 41, our data was below, so it's not good. But that's a special case because of COVID. During months of March through May, the shelter was shut down, so not many pets were brought in or not many pets were adopted. So for now, we would like to ignore those 2 data points.
That's the same question I asked the other team. I got one other question. So if the data was not normal, would it affect this chart at all?
Sorry, I didn't like.
If the data was not normal, would it have an effect on this chart?
Yeah, so if the data was not normal, then it's like it won't be likely to be okay. We won't be able to predict it too well.
And so the same question. So those points above the upper control, any ideas of what caused those?
Yeah, so during those 3 months, actually, our incoming pets were also too high. So if you see the ratio between incoming pet adoption to incoming pets, it's actually normal. But just because we're looking at the number of adoptions, not the percentage, it looks like it's too high.
So you're saying that they had more pets in to be adopted, and that's why there's more adoptions.
Yes.
Okay.
This is our process capability. And our CPK was actually below 1.33. So that means our data does not always meet the requirements. So we're trying to like stabilize the data as much as possible. Like just in the chart before, we could see that more pets were incoming, like in some months, more pets were incoming and hence more pets were adopted. So instead of that, we're trying to stabilize the data as much as possible. So every month there's a consistency between how many pets are incoming, how many pets are adopted, and different ways.
Okay, so this is our analyze phase.
Can you guys go back, please? So could you explain why you guys use both LSL and USL?
Well, okay, so we just actually wanted to only use LSL, but
why would you want to use LSL?
LSL because we're trying to minimize the or we are trying to maximize the pet adoption. So we want pets to be more than the LSL.
And how did you guys come up with the LSL of 150?
150. Okay, so we used we looked at the data from all the months and we got the number.
What was the minimum adoption rate that you guys were planning for?
41%.
No. Planning for is 60%, right?
Yeah, like our goal. Yes.
Yeah, and so 60% of the average is 150?
60%
of the monthly average.
No, actually, I think, okay. So we did the 60% of maize accumulative. And we got 150 from like the whole 41 months. And 60% was only from May.
Okay.
Okay, so this is our analyze. So here's some list of our input variables. So we have the incoming shelter animals, the animal's background, so like its age or the type of breed it is, the adoptions, the promotions of the shelter, so either at the shelter or online, the inquiries, the staff, and the families who are willing to adopt.
So this is our 5 whys chart. So the problem is pets are being killed. And why are pets being killed? Not many pets are getting adopted. And why people prefer private breeders over shelters. And why people think that private breeders are like more safe and the pets are in like better condition than shelters, because shelters you get them, you have like all different breeds and different types of animals, and like basically a private breeder you might only have like one breed or like one type of animal. So basically the root cause here is that shelters do not have perfect pets for people, and private breeders do.
And this is our improved phase. So these are the main list of KPIVs: incoming shelter animals, the animal background such as the age, type of animal, and the breed, and the promotions of the shelters on online and at the shelter. And these are a few solutions me and my group brainstormed. A meet and greet where we can bring the pets. We can bring the pets to local businesses and events. And we can also advertise on social media, and we will have a thorough checkup of each pet.
So the stakeholders.
Go back to that 1 second. Go back to the solutions. Let me look at them 1 second. Okay. So the process you were looking at was when the people fill out the application, they go into and they look at the pet. What is the advertise on social media? Is that pertaining to that process?
It's basically to raise awareness to people to like, or inform people to come and like persuade people to come and adopt an animal at the Wake County Animal Shelter. So the stakeholders in this project are me, Shuduthi, Vinita, Shreya, Wishwant, and the Wake County Animal Shelter. And everyone was brought into it, and everyone liked the solutions that we came up with. So did the solutions make an improvement? So we had solutions. We proposed them to the Wake County Animal Shelter. They liked it, but the only problem is they couldn't test them out due to COVID.
So this is our control phase. So we had some potential ways to control the improvement. So one of them, so social media promotions, so we can get more people interested. So we could do live virtual events from the pet shelter, and we could try to do these every month. And we could also do promotional videos. We can make fundraisers to raise awareness, and we could do these every quarter. And we can celebrate International Animal Days or Pet Days again to raise awareness.
So the last bullet point says pet checkup for the public. So what we mean by this is we found out that when we were getting our data saying that half of the incoming pets are stray or they're lost. And if they're lost, they have no information about their owner on them. So they have like no microchip or like no contact, like no call or anything. So we just wanted to suggest pet owners and to make sure that their pet has a microchip. So in case your pet gets lost, you can get it back. And also to vaccinate your pet so it's up to date on things, and also so you're safe and your pet is also safe. And also to spray and neuter them for natural reasons.
So our project overall benefits are obviously we were trying to focus on fewer pet deaths, and also pets bringing home pets will obviously help pet owners trying to get more exercise, and it's actually research proves that having pets is beneficial for pet owners. It helps them reduce depression and helps people socialize more, and also keep them fit, because pets needed to be taken on walks and stuff, which helps pet owners also exercise. And this is our presentation. Thank you so much for your time and patience.
So one of the comments I have is on the stakeholder. is on the stakeholder analysis, and this applies to team one as well. So what you want to, you guys are all putting down your own names, but the stakeholders are primarily two things. They're the people that are affected by the results of your project, and they're the people that have an influence in the process that you're doing to fix the project. Okay, so if you think about it in this process that you're looking at, who are probably some of the main stakeholders that can affect the results of your project that you didn't list?
The pet owners.
Okay, so the process is you're going into the shelter and you're talking to the people that work there. I just gave you the answer. And so the people that work there are they're major stakeholders in there, okay? Because they probably have more influence on whether those pets get adopted than anyone. So you didn't you need to focus on them in terms of the causes. They're probably going to be, the way that they greet the people, how they clean up the pets, the appearance, all these things are probably a major factor why the pets would get adopted or not. And you need to focus on that. So it all starts with your stakeholder analysis and understanding who's important in this project. I think when you say that the people that worked at the shelter probably have the most influence on whether the pets get adopted, because you're not looking, you said initially you were looking at from when the application is done until they come out there and they check the pet out. So the advertising really separate process, marketing and advertising. So if you're if you're trying to fix the problem of when they're actually in there, the people that work there probably have the most influence. So that's the main thing. Your analysis of the data was very good. You had a great problem statement, great objective. I really like that. And your analysis on your data was excellent. I would just focus really on that key thing is if you want to solve this, you got to look at your causes, understand the cause a little better, and then solve those, put solutions in place that solve those. So, I mean, I'm just sitting here thinking a lot of things that come to mind of why people probably don't, adopt pets when they go into these shelters and places like that. Maybe the pets aren't clean. Maybe they're barking too much. I mean, there could be many reasons that someone says, "Oh, I don't want to pick that dog."
Thank you for your feedback.
So there is feedback and noise coming from some of the phones. I don't know whose audio system it is. Please try to maintain the etiquette of considering while other people are talking. So I have some feedback, right? It's a great project to start with, right? I understand you guys had some data collection related difficulties. And I understand the implementation part of it is a little bit of a challenge considering the current environment and the, I want to say, difficult communications that you had to do. But I personally would have wanted to see a little more meat on your 5 whys and the solutions associated to that, because you guys stuck to one solution, which is basically saying that the pets have to be perfect pets, meaning that the pets have to be prepped properly. That's a very small part of the entire process that you guys are trying to go after. Very, very small part. Right, and you guys probably should have practiced it a little more, because I saw some inconsistency in terms of the handoffs and some technical difficulties in terms of whether it's the phone or whether you guys are voice is not coming through across and so on and so forth, just some logistical things, right?
Uncle, is it okay if we go next? Me, Kalyan, and Sindura.
Yeah, before that, I do want to request Lucas one comment. So Lucas, anything that you would suggest for this team to improve upon?
It's just your presentation was shorter than the first one. I think it flowed better in that sense. There was just some as Suresh said, some difficulties in the hearing part, but that's technology, right? I would just really focus on understanding the causes of why. I think Suresh and I are saying the same thing of why people aren't adopting them, and I think your causes are all going to be found out by interviewing the people that work there, or possibly the people that come in and try to adopt them. So if your stakeholders are those two people, you can easily ask the people that come in there, why didn't you adopt someone? And you get 20 people and get those results and categorize them and come up with the most common reasons. And then you could also get feedback from the people that work there. What do you think are the reasons? Once you have those reasons, you go back to the people that work there and say, we found out these were the two main reasons. The place is unorganized, they wait too long, or the dogs don't look like they're treated well. So whatever it is. And then they fix those. That's it.
Thank you for your feedback.
Next, Atish and team.
Yep, Kayan, if you want to share your screen.
Yeah, I'm doing it.
In the meantime, Mr. Srinivas, could you please see if everybody is still on the call? If somebody dropped off, if any of the students have dropped off because their project is done, could you please let me know?
Yeah, sure. And I am watching.
Yeah, thank you.
Yeah.
Hi, my name's Atish.
I'm Kalyan Reddy,
And I'm Sindhura.
and this is our project reducing the days on market for houses in Forsyth County. So our problem statement was that the average listing on days in Forsyth County is causing more homeowners to pay more fees, and it's causing them to turn away buyers. Single family home listing days are averaging at about 111 days, and the highest we saw was 185. This is a pretty long time to have days on market for, and cutting it down will help save homeowners money and stress. And our goal statement is to decrease average single family home listing days on the market by 35%, from 111 days to 72.15. So we rounded that to 72 days by January 2023. For our metrics, our primary metric was reduction in the average home listing days and average home listing time in days in Forsyth County. And our secondary metric is easier processes required in selling homes and a boost of the economy.
Can you go back? What's the metric? Reduction is the goal, actually. What's the metric?
Just days on market then.
Okay, so it's average days.
Yep.
Per home?
For single family homes.
Okay.
So this is our stakeholder analysis. We did it based on us. We're just trying to get like the buy-ins from everyone. And this is our interest, and this is how much we think that given the opportunity we could try to influence this. Our goals, hopeful impact, and this is the average of our interest and influence. So what I wanted to do was I wanted to make it so that people selling their houses had less of a hassle and less of a profit loss from selling their house.
Okay, and then okay, yeah.
You can go.
All right, so what I wanted to do was like to simulate the real estate, like kind of business in the area, so it could like boost the economy a little bit more, and so more people would actually try to move into Forsyth County.
Yeah, and then for me, it was kind of the same, to make the process of buying homes easier and to make it more profitable for individuals selling their house.
So for our SIPOC, we had a bunch of them, and for the process of decreasing prices on homes, the supplier would be the home buyer. Inputs would be money, and the outputs would be decreased days on the market, and the customers would be home sellers. Atesh, you want to do the rest of them?
Yeah, I mean, I guess you guys, I don't know if we really need to read it out for the sake of time. If you want to take a quick look at it, you can. But I don't know
Sorry,
if it's,
Shempo, should we read out like the entire thing, or do you want us to save more time, seeing that it's already 5:10?
So, Lucas, it's your call.
In terms of going through this in detail or skipping to the next one, is that what the question is?
yeah, for the sake of time.
Yeah. I kind of get a sense for this. So you're looking at advertising for the most part, right?
It's
Okay. All right. I
Yeah.
got it. You can go on.
And this is our waste model. So for defects, something in the house that just doesn't appeal, like maybe the outside coloring is discolored, or the paint's not the color they like, or maybe some wood got chipped. Overproduction is just building more houses. Like there's a subdivision up there that's being built, and if they built too much, then some of the houses could go to waste for a little while. For wait time, it's delay in response times of real estate agents or home sellers. So since they have so much tours and so much different people visiting, it might take a little bit of time. Not fully utilizing people. Either there's too much realtors or the realtors you have are bad. For inventory, we said just finishing having too much material left over or having too much people to work. Promotion, it's just extra trips. Like basically this entire thing could be solved by streamlining the process. And then excess processing is just too many meetings, repeating the same thing over and over.
Just one comment on that, and some of the other teams are doing this too. Make sure you only look at the wastes in the process that you're analyzing. So think of the steps that I'm trying to improve. In building more houses, you're not looking at the construction of all the homes in the area, right? So you don't really need to list any waste related to processes you're not looking at. So just focus on the ones, the extra trips sounds like it's relevant, bad realtors, delay in responses. Focus on the waste in the process you're trying to improve. Okay. All right.
Okay,
Go ahead.
thank you.
Thank you.
So for these are our hope, like what we hope we can achieve for benefits. Just a little bit of a boosted economy because more people are attracted since houses are buying and selling faster, so the market becomes a little more fluid. More education will be available because of the increased population. So because the government will have to sort of focus since the population in that area is getting bigger and bigger, and homeowners will have less stress to find buyers soon. For the obstacles that we faced, so we pulled our data off of Redfin, and there's a 350 like data cap, so it'll only let you pull 350 data sets at a time. So it might be biased since it just randomly chooses from the 2,000 data sets that they have. Another obstacle could be that there's a mistake in the data, or that Redfin doesn't have every single house in Forsyth County recorded. So onto the measure phase.
Okay. Yeah, onto the measure phase. So this is our data, which is like we showed in the benefits slide, I think. And so this is like all the homes and all the data that we used that we analyzed. And yeah, you can see like there's like a number cap, so the data might be a little bit biased. Yeah.
So we had two data sets. This data set is for houses that have already been sold. And this data set, once it loads, is for houses that are still on the market. And this one's a little biased, as you can see in the days on market. For some reason, a lot of people have decided to just keep re-uploading, so you have a bunch of these ones. And that was a little problem we faced early on until we figured out you could do sold houses. So that's where we got this data set from.
Old would be better because the ones on the market, those numbers aren't finalized, right? They're going to keep growing.
Yeah.
So
Yeah,
would
but
just look at
as
sold.
the people who were listing them, they kept re-uploading them, so we couldn't actually like gauge like the exact amount of time that they actually had it on, like originally had it listed on Redfin. So that's why we decided to go with sold homes because you could actually see like how long the home sellers like they waited until like their home was bought. So like that's why we decided to use that.
I would agree.
And so these are some suggestions from a realtor. And so like, and then I probably won't read them for the sake of time, but we got them from an actual realtor.
So what's this slide, the purpose of this content on this slide?
We just contacted Sindor's dad. He's a realtor.
Mm-hmm.
And he said that these are some things that you might want to look out for to put into our
Also, these are some things that we took into consideration when we were like analyzing the data sets. So like we could like kind of see if what kind of problems there might have been when someone was selling their house.
Okay.
So this is our data sampling and measurement system analysis. Since we got our data off Redfin, it's a real estate website which allows users to list and view homes. And also due to a limitation by Redfin, we can only pull 350 results for each search. So like that means we got 700 total, 350 from sold homes and 350 from unsold homes. And so we decided to trust Redfin and not do the measurement system analysis as it's a credible source since many realtors use it.
So this was our sample size calculator. And for our population size, we got it because on Redfin, this amount of total sold homes plus homes on market, sold homes in the past 3 months and homes on market now equal 4,100, and we got our sample size to be 352, and that's around our sample because of the fact that half of our sample is houses that haven't been sold, and half of it is houses that have been sold.
What's the confidence level?
95%.
Okay.
So there's 4,100 houses, and is that the population? I'm having a little trouble reading.
Yeah. So yeah.
4,100 is what?
Yeah. It's the population size.
Okay.
It's a population size.
All right. Okay. So those are the you had 4,100 where you got the average days for on the market. Is that what you're saying?
Yeah.
Okay. All right.
Okay, this is our data collection plan. So basically, we were looking for the amount of houses sold, and then all of our data is pretty much pulled from Redfin. We tried to do Zillow, but they don't have a download all feature that I could find. And we tried to use some web scrapers, but that sort of got complicated. Houses sold as a discrete data type. It's an output. Price is a continuous data type, and it's an input because that's what you're inputting. The amount of beds and baths might not seem like that important, but when you're looking for a house, the amount of beds, rooms, and bathrooms in the house is really important, and it's an input. Days on market is a discrete output, and it's just the average time that a house spends on market. Square feet is continuous, and it's an input, and it's basically just the amount of how big the house is.
This is a process map. So if you want to click on it real quick, and I think Sindora can explain that one.
Okay, so this is our general map of our process. So first thing is you want to sell your house, and you find an agent for that. If you found an agent, yes or no, and then prepare your house for listing and uploading it on sites that can list your house, and then you can arrange showings for your buyers. After that, you can review the offers and negotiate to come to a price, and then sign the paperwork, enter a contract. And there's a lot of back and forth here. If they don't agree on the price, you have to renegotiate that. And then the buyer completes the inspection, and then the buyer needs a mortgage approved with the proper applications, and then the last step is to sell the house.
Okay. Yeah. And so this is our Gantt chart. Dora, if you want to go over that one too.
So yeah, this is a general overview of our timeline for this whole project. As you can see, we have the starting dates and end dates, as well as the status of each deliverable.
Okay, so key factors that we
So these are KPIVs and KPOVs.
yeah, so square footage, appearance and physical features of the house, and pricing are all very important input values. And Redfin contains all of these, so that if Redfin contains them, they're pretty much one of the more important input factors. And I don't know why we duplicated this slide on accident.
A quick question. You're saying they're important because the what was it, the name of the
Redfin.
Redfin, because Redfin indicated somewhere that these are important factors, or he determined these were important.
Because like these things are generally what we normally look at when you're looking for a house, and that's like kind of the most important things that were highlighted on Redfin.
Okay.
So we kind of drew that from that website.
And for KPOV is just days on market, because that's what we're trying to figure out from this project, or that's what we're trying to lower.
So regarding the KPIVs and the KPOV, more on the KPIV, following up on Lucas's question, yes, you took some feel-good factor or some opinions to come to the KPIVs. Did you guys do some analysis to say that these are statistically proven KPIVs?
I think we get to that later in the presentation.
Okay, I'll wait. I'll hold on my question and wait.
So this is our fishbone diagram, and we just basically listed a bunch of different things. So for measurements, you have like square feet, acres per property, distance from grocery stores, average mortgage. For materials, you have money, construction materials, deeds, insurance and lease agreements. For people, you have realtors, buyers, sellers, construction workers, and home flippers. Construction workers aren't really necessary for our thing because we're looking at selling your house. Environment is area taken, amount of traffic nearby, amount of nature in the area, and population of harmful animals. And our methods would be listing a house for sale on websites or real estate agents, advertising through billboards, TVs, selling to agencies, loans, social media, all that sort of stuff. And we made 2 5 whys. Does you want to go through them?
Yeah, sure. So then, so like we asked ourselves, we kind of discussed this in our group, and then we kind of wrote them down as we went. So like what we were thinking, like, why are houses taking so long? Because people don't like the house, because the house doesn't look good or meet their specifications. Also, it might have like a defect or something, or the builder might not have built it correctly, or like there might be like some kind of defect. There might be like a there might be like a wall instead of like open space, or like a balcony instead of like another room, a possible room. And then there also could be the material that they used to build. Some materials are a little bit more stronger than others.
Let me ask you, go back to that. All right. So, I mean, in some of the other groups, I've seen this as well. What is the purpose of the 5 whys?
It's to find the actual problem that you're trying to solve.
Right. The root cause, right? And you keep asking why until you get to the root cause, because what sometimes people tell you isn't the root, it's just an effect, right?
Mhm.
So go back to that. So are we saying the root cause, one of the root causes why houses are on the market so long is because the builder didn't build it correctly?
No.
It's mostly a decoration issue for this one. The builder didn't build it correctly as one of like the side ones, but the main one was that the owner didn't decorate it correctly.
Or, like there's some
Because
physical aspects of the house that didn't appeal to the customer.
the exterior of the house is the first thing that your client or the buyer will see. And it's very important that you maintain the exterior of your house. Even if you have like a great interior, if the exterior looks a little shabbier, they will not like the house as much.
And how did you, maybe you'll get to it, but I'd like to know how you came up with that cause, but keep going.
And so this is our second one. And so like so we asked ourselves, why are houses taking so long to be sold? And it's because people don't like the house. The price is too much and the owner wants a bit more money. This could be like lead to like disagreements in terms of like cost between like the potential buyer and the seller. It's like sometimes you have to actually gauge it properly based on your property and like the square footage based on like the market, how the current market is holding. So
So see this, when you ask the question, why houses take so long, because people don't like the house. So the next question is, why don't people like the house? So you're saying the price is too much?
we kind of meant to focus more on the physical aspect instead of the price. So I think we kind of went wrong over there.
Okay. All right.
So these are summary reports for our unsold homes. They're on the next slide.
So we basically just put a bunch of different graphs on Minitab. As you can see here, we have a lot of them. And
can you tell us what these graphs are telling us? What should we?
Yeah.
Why should we care about these?
Okay, so for year built, you can see that typically most of the houses built are in the 2000s. This means that more of the houses are modern, and less houses are from ages like 1940s, 1960s. As you'll notice, this is a little bit of a trend. Most of the data that we pull is not normal, and it's kind of unpredictable. For days on market, the average day on market is 111 days, 112 to 111 days, as we said earlier. It's not normal either. Okay.
Why are we looking at the year built? What is, to Suresh's question, why is that important, the year built? Or the year, yeah.
It was one of the input values we sort of considered. We determined it wasn't that important later on, but we just kept it here because year built is somewhat necessary for someone buying a house.
So why don't you think it's important? Did you show? Go ahead.
It's not as important, like we've discussed it. It's not as important as the other input variables.
Okay.
And this is our price. As you can see, most of the price is around 150,000 to 300,000. It's not normal either, and most of the data is around this cluster. Can you see my mouse cursor?
Yes.
Okay. Yeah, most of the data is around this area. Standard deviation is pretty high. There's a lot of difference, like down here especially. There's a couple outliers, but these aren't ones that you typically be buying that much. And we just did one for beds because that's also an important one. The average amount of beds is 3, and 1-bedroom homes are typically less pricier. This is our baths, and most of the baths are around 2 to 3, and almost none of these things are normal either. Square feet, typically you'll see either like 150,000 to 200,000, 1,500 to 2,000. And this is just lot size, which is basically not the square foot of the actual home, but the actual like acreage of the land around it. And typically it's around 50,000. Atish, can you take over for a little bit?
Yeah. So yeah, and then can you go back real quick? Yep. So like you'll see like a lot of these p-values are going to be less than 0.005 because the data isn't normal. That kind of reflects like the current situation of the housing market in Forsyth County right now. So currently, yeah. So these are IMR charts. Yeah, so then you can see like our UCL and LCL. Wait, Keanu, are you speaking?
Yeah, cool. Okay. So as you can see, most of the prices are around 230,000. These outliers are typically the more expensive houses. This is beds. You'll see that there's a lot of like beds at 3 and a little bit more at 4, or a little bit less at 4. So 3 and 4 are typically your more average amount of beds in the house.
What should I make out of this? If I've got outliers or prices are higher or has more beds, what does that tell me?
We were sort of just keeping these here as more of an information thing, not as an actual like try to find data out of this. We were just sort of like trying to represent the data that we collected in this.
Okay.
So, I mean, I do want to latch on to what Lucas was trying to get at here. Did you guys do any segmentation or segregation of the data? As you can see, there's almost 3 levels or 4 levels of pricing.
We didn't really try to segment it.
Or baths in this particular case, right? If it is a 1 bath, what's the number of days? If it is 2 bath, what's the number of days? If it is 3 bath, what's the number of days? You can see that sectioning that's happening in there.
I guess that's kind of how I would approach this too, guys, is maybe I was saving this for my wrap up, but I think you had really good data. You could probably analyze that and try to determine just from data analysis, what are some of the factors that maybe make a difference in price. Are houses with 4 beds on the market a lot less than houses with 2 beds? Or those kind of things that might lead you to where you want to focus your efforts on, which could lead to a reduction in price, possibly. So maybe the houses with 2 beds are priced too high, and your data shows that they're not selling. And so it's really what Suresh is getting at, is looking at that data and putting it into categories and seeing what is on the market less versus what's on the market more. What are the factors that contribute to it? And then that would be a starting point to analyzing and coming up with solutions related to that.
Okay, thank you.
Sure.
We'll try to do that.
I think we were more focusing on like the general aspect of just selling homes, and we didn't really focus on kind of splitting apart like the various aspects of each home. Kind of like yeah.
So there's a lot. This is some of the other groups have had this too. Is you guys are trying to look a little bit at too many things, and this is a tough one. This is a tough one to fix. So I guess I would approach this from looking at data first and seeing something, and because you guys got pretty good data. I think you had more data analysis. You had more ability to analyze data than any of the other teams because you had a good spreadsheet there with a lot of inputs. And that could be the starting point for determining what do I really want to focus on. And if you find something in the data that points, hey, I see a pattern here. This seems to be a reason why houses are on the market longer than others. And then you can focus on making changes to that. I mean, you guys were your causes and solutions seem to be related to fixing the house up. Well, you can do that to any of them. And a real estate agent already knows that, right? So you're not bringing anything new that they don't know. they're going to tell the customers that. I think you guys are going to probably, you can provide something that the real estate agent won't. They're not going to do any data analysis. Guarantee you they won't. So you guys could bring something to them they've never even thought about. Go ahead.
Okay. Thank you. We'll try to implement that next time. So these are all our sold homes, like the data. I forgot to mention that earlier, but this data is about sold homes. So these are our average days on market for the sold home. And there's only really one outlier up here when they go below, and it's like 1 day on market. But typically this is in control. But what we were trying to do is reduce reduce X bar. And this is year built. As you can see, there's a few data points which have their year built around 1900s. But typically you can see it's like 1988. And these are our scatter plots. They don't really mean much, but as you can see, we just try.
Okay. This is what Lucas and I were indicating earlier. So based on the price, what kind of correlation do you guys see?
Typically, the higher the price, the more days on market you'll have.
Is that what it is telling? Are the data points linearly going from bottom to the top?
No.
No. They're just scattered, but where is the most of the data points lying?
Around.
Right around there, right? And what it is saying is, what Lucas, I don't know, he has a crystal ball to predict, but he said it right. Around $200,000 is where you see a lot of the days on market activity, 200 to 300, right? That would have been a good segregation point to see why is it that the houses between 200 and 300,000 has a lot of days on market activity, meaning there is no correlation, nothing. Let me go in and see if beds make a difference, if the lot size makes a difference, if something, maybe the year built makes a difference, and so on and so forth. And you have the data on your next chart, which is beds here, right? And which houses have, which beds actually have a highest number of days on market?
2 or 3.
Yeah, 2, 3, or even 4 actually, right? Because it goes from the low all the way to the top actually. You guys don't have to pay attention to 5 and 6 because those are high priced, and maybe that county doesn't have enough economic clout to be able to sell those houses quickly. So I'll reserve some of the other things because I want to see what else you guys have done with the data. And similarly with bats, similarly with year built, right?
Okay.
Okay, continue.
These are our 2 sample t-tests. This is just trying to find the correlation between baths and beds.
Correlation between bats and beds?
We were just trying to see basically whether the amount of beds and baths were around the same for each house. So trying to see if the means were around the same.
How would that help us actually?
I don't really know how much it would help. We were just, at this point, we were just trying to find out like the data. We're trying to analyze it a little.
So what is your goal actually?
To reduce the days on market.
Yep. So that is your why. And you do a hypothesis test to find out what? If the X has a significant impact on?
The Y. Yeah.
Why? So the excess that you have in terms of the data is beds, bath, year built, lot size, square footage, and so on, right? So if you had to rerun this analysis, which analysis would you run actually? What kind of hypothesis test would you guys do?
Days on market versus the other things. Versus the
Days
other.
on market versus bed, right?
And then days on
Does
market.
number of beds have an impact on?
Days on
Days of market, right? So that's how you would run the hypothesis.
Okay.
Because comparing bats to beds, I don't know how that is going to. Let's wait for the next step of the project.
Okay. So this is just the year built. The mean is around 1988, as we said earlier. Atish, can you take over for a little bit?
Yeah. So then, if you want to go to like improve, we can skip these because we didn't really need them. And so yeah, these are capability analysis, and you can see like the probability of the square feet and like the means. I wrote them down a little bit so you could like see them a little bit more clear. So the mean of the square feet is 3,824, and then the standard deviation is 3,197, which is relatively high. And then for the probability plot of price, it would be 321,027. The standard deviation would be 232,021. It's like the probability plot of days on market mean is 27.95, and then standard deviation would be 22.16.
And as you can see, none of these probability or these normality tests, none of these values are normal, which is kind of indicative of the state that Forsyth County's real estate market is in. And these are for the sold home, or yeah, these are for sold homes. We just basically did the same things as earlier. I think for this part we focused on the wrong things, and that basically nullifies what we have here. So if you'd like, can I skip through it?
Yeah, please.
And this is our normality test again. None of these values are normal either. And we're on improve, so Atish.
I can do improve. So yeah, so listening to the feedback, yeah, I think we kind of failed to find some correlation between the data. So this is not really much of a correlation, but this does show that for the process capability test for unsold homes, in the short term, they are sold below 72 days, and the USL is 72. So because that the PPM value is 23061, we can say that 23% of the time the values will go above the USL. And for the sold homes, that means in the long term, they're not going to sell within 72 days. And because the CPK is in the negative value, this shows that this process is not capable and has the possibility of showing various results. So for our improvement plan, based on our analysis slightly, we decided that it would be good to implement a competitive market analysis. So that is a way to identify our competitors based on the state of the current market, and we can help decide how to get a leg up on our competitors and form our strategy. So we do believe that CMA can be an attainable solution for homeowners in Forsyth County so they can sell their homes in fewer days. And having a knowledgeable realtor is very important for identifying the proper CMA. And as we talked about before, we did focus on a lot of about improving the exterior decoration. So this is just about that. We did say improving the curb appeal and staging the house can lower the days on the market by improving attraction. And that can be done by planting flowers, shrubs, anything like that, making it more appealing, as well as we can advertise it on social media. And then for sure, having a good realtor with good negotiation skills is always important.
Just a comment on that. I've sold a lot of I've sold my houses. I haven't been a realtor, but obviously everyone tells you that that's an important factor. If I was going to take your advice on that, I would want like very detailed. You know, here's some examples of houses that sold versus ones that don't. You can see the hedges here look like this. You know, it has to be very specific, because you know, just reading this, I would just say make sure my lawn is mowed and my hedges aren't too long. But I don't know if that would really make a difference in selling my house. In terms of you know, that's kind of obvious. I would get into really detailed, like you almost have to do interview agents or something and show pictures, and that would help me. It's like, okay, I see what it looks like. That will make a difference. You see what I'm saying? It has to be very detailed.
Yeah, and like we didn't have data to support that, so but I think that was where we went wrong. So
yeah. I'm just telling you, I like what you guys are doing here. It's a tough one, but I think there's actually opportunity here. I think you guys hit on a good topic.
Thank you.
So this is our control phase. So the control plan, it's kind of like as written previously. To keep our home listing time low, we recommend the following. It's like physical aspects, like fixing and like updating physical aspects of your home, and like actually like understanding how the market is currently going about. So like the price per square footage and the acreage, like the average price of homes like with around the same acreage. So you can like give your potential home buyer like an actual fair price, so they can decide if they actually want to buy it based on that price. And yeah, so kind of last thing is like making sure like your price and like is competitive with other people in your area who have the same acreage and same square footage, almost the amount of same beds and baths. So like you can give the home buyer, like a potential home buyer, the perfect price for them, and they can like kind of edit it a little bit here and there in case. And so this is our SOP. We can't make definitive rules yet as our solutions haven't been implemented. So here are a few guidelines. It's basically as listed before, making sure your house is presentable and like making sure you're like educated based on the market. And yeah, advertising is especially important because you can let people see homes that they wouldn't really know they needed, or we could like just show other people outside of Redfin. So our benefits, the real estate and the economy in general in Fort Lee County will be expanded. The process of selling and buying homes will occur more effectively and efficiently. The economy will also be like stimulated as more people are living in more houses, and as more people come to Forsyth County and buy homes, more jobs and companies are going to be created. So these are references. Thank you.
So, I mean, this is a data-rich project, right? And what I would request is if you guys can go back and run some of the analysis related to the hypothesis testing and looking at a scatter plot to begin with, right? If you, what is the relationship between days on market versus number of beds, year built versus number of beds, and take each of those factors, right, and see what the scatter plot might be telling, or run the hypothesis test as we indicated, which is does beds make a difference on the days on market, right? Is there a significant difference between one bed more than one beds? Or if you think the average number of beds is 2.2, then stick with 2. Is the hypothesis telling us that the number of days on market, is it significant between between having 2 beds versus more than 2 beds? Run those kind of hypothesis tests. That'll give you the factors. Then you can actually focus on indicating that you can say for 2 beds, most likely your house is not going to be sold within 70 days. For 3 beds, it's not going to be sold within 90 days because that's what the data is telling us. And so it is not only just reducing, but level setting it for the customers. right? I mean, people can promise that, oh, I'm going to put it on sale for within 30 days. But if the market data is not telling you that, then you can actually use that data to level set it appropriately with the people to say that, the market says your house is not going to be sold within 45 days because this is what the data is telling us.
I would agree with that. If I was a seller, I would want to know, based on the analysis and how many beds I have, the square footage, whatever else you have in that data, that if you put it in at this price, it'll sell in 30 days. Or if you put it at this price, it's going to be greater than 30 days or something like that. That gives me an indicator of how long, what's the price what's my tolerance for how long I want to keep it in the market. Let's say I want to, maybe I'm moving to a new job and I only have 30 days. So I'm going to set it at 250 instead of 280, what I thought. So that's the question that what Suresh said that you can answer for me. And that is a question people want to know.
Yep. For your benefits, as Lucas was indicating, think of it this way. If the house is not going to be sold until 90 days, because that's what the market data is saying, can the seller afford 90 days being on market, which means they have to pay 3 months of mortgage, 3 months of maintenance, 3 months of utilities, and so on and so forth. Now, if all of that are added to $10,000, let's say, theoretically, and is the buyer, not the buyer, seller is willing to put it down by 10,000 so that it's a wash for them, right? If they can sell it, if the price is lowered by 10,000 and they can sell it in 30 days versus 90 days, then maybe the seller might be willing to actually sell it. And that's where this analysis actually helps, because it's not always about reducing the time on market, which is a good goal that you guys have had, but there is other opportunities that you could have indicated from the data. So I would say, please please go back to the drawing board and run that kind of analysis. And then please submit the project. And I would say the same thing for team 2 also. Lucas, would that be a fair?
Yes, no, absolutely. I would agree with that. Those team 2 and 3 rerun the analysis to understand the causes and then the appropriate solutions based on that. Team 2 is a little different than they were more specific. I think we know what the scope of theirs is going to be related to their process of going to the pet, the place with the pets, whatever you call it. Yours is a little, right now, we're not really sure what answer you're going to give us. So I think you need to do an analysis to understand what, as Suresh says, what questions can you answer for the buyer if you know that they want to sell, and here's a price, and given all the different scenarios that when I might want to sell it, what advice could you give me?
And I'll actually give a small example, real life example. So Lucas, you know Rick, right? So Rick was actually putting his Kerry home on sale, and the real estate agent told him, put it at this particular X price. And Rick and I were discussing, and we just ran some analysis quickly, 30 minutes. And then I said, Rick, you can bump up your house price by 40,000. And then he immediately took the screenshot of the analysis, sent to his agent, and his agent said, give me 2 days. And then the third day he comes back and raises it by 35,000. Day 1, it gets sold, even at the higher price.
Did he give you a percentage of that?
He's my boss. So your project actually has some good outcome that you guys can actually share. And I really want, once you guys rerun the analysis, what I wanted to do is pull in a few real estate agents, and I want to showcase what you guys have done. I want you guys to showcase in terms of what you have done, in terms of how you have studied this real estate market in Forsyth County, and what are some of the insights that you're providing.
Yeah, it's a good project. I'd be interested. If I'm selling a house, I want you guys working on this.
Uncle, can our group go next?
Yeah. So any questions from this team?
Not really. I think we know
Yeah,
what
no,
we have
that
to
sounds
do.
good. Yeah, definitely appreciate the feedback. I think instead of finding correlations between one variable, we should find it between two or more. So that will be our next step, and we can definitely make a new presentation.
Please.
Thank you.
Thank you for the efforts and sharing the details with us. Thank you. Next team.
It's us. It's me, Sadhvi, Anish, and Ved. Sadhvi, you're sharing the screen. Yeah.
Yes, I am. Ooh, give me 1 second. Okay. So our project is about police brutality in especially Raleigh, because as of the past few weeks and months, there's been a lot of social revolutions going on in this area, especially with the George Floyd and everything that's going on right now. And we just felt like it was really important to target this, since Raleigh is a big place for police brutality and there have been a lot of cases here. So we want to target this with our project.
Okay, so this is our Gantt chart for Define. We have our deliverables, who's responsible for them, and the timeline in which they were accomplished. Most of Define was done by all four of us as a team. So our problem statement is that based on 2018 and 2019 data, the number of police interactions where force was used increased by 30%. This may have contributed to an increase in shootings and fatalities. We got this data from Deputy Chief Todd Jordan of the Raleigh Police Department, who was very helpful and a major contributor to our project.
I got a question right off the bat here. And I don't know if you asked him, but what is interactions where force was used? How do they actually capture that? And what does that mean?
Force is kind of any physical contact in general. So if that includes tasing and obviously gun violence, any kind of hitting, anything other than like just talking and not getting physical is force, is what they consider as force. But this is different from excessive force, when sometimes force is necessary. We obviously understand that when the victim is getting violent, but this is different from excessive force, but we're just referring to force in general, which we don't think is necessary in every single case.
Okay, good answer. You know, I'm surprised they actually collect data on that. That's good.
That's actually a little bit of foreshadowing to our next slide. You'll see about that. But
so what is police brutality? Our definition of police brutality is police officers using excessive or unneeded force against a subject. This includes, but not limited to, physical or verbal assault, property damage, physical or mental injury, and death.
And as we said before, this is different from just force in general. This is excessive force.
What is this? So you guys are just, go back to your problem statement one more time, real quick.
Sure.
You're just trying to reduce the force, not excessive force, right?
Right.
Okay. You just showed us that to show the difference between force and excessive force.
I'm sorry, say that again.
You showed us that the excessive force, just to show us what the difference was between that and what you're trying to improve?
Yes.
Okay.
And since, excessive force does obviously stem from force. So if we can tackle this problem, it's kind of like a chain reaction, if that makes sense.
Yeah, that's a good point.
And then, so you just talked about our data collection efforts, but we did actually run into quite a few problems while doing this. We were able to collect data on race, gender, number of cases of force, and physical arrest, and a lot of helpful things, but these were all per year, and it wasn't specific enough for this project, unfortunately. We're not exactly sure why this was the case. It might have been because data was, they wanted to keep it secret, or it was confidential, and the police officer didn't want to reveal this to the public in order to have like a bad name for Raleigh. But in general, this didn't end up being enough, so we had to make mock data in order to represent our data.
Okay, so our goal statement was to reduce the average number of cases where force was used in 2018 and 2019, or 468 cases, by 60%, giving us 187 cases. Again, we got this data from the Raleigh Police Department.
Coming to our metrics, the primary metric is the process defect and is the direct output of a process. So for us, it was cases where force is used per year.
Okay, so this is our process map. Okay, so ideally when the police department takes action, they either receive a call requiring their services or a police officer observed the violation. At this point, they have to ask themselves, should they intervene? If the answer is no, they have to ask themselves if another department would be able to handle this better. The answer would be yes in cases of fires or if someone has an accident and needs a hospital, in which case they'd contact the fire department and like a hospital, and they would contact the appropriate department. If another department can't handle it better, such as prank calls, then they just leave it as is. If they should intervene, if this is a job for the police, there are two paths this can go. The first path is the police department receiving a call. When the police department receives a call, they gather their team and get as much possible information on the way to the site. Once they've reached the site, they ask the civilian as many questions as possible. And then, is this a case regarding a civilian who is mentally ill or has a developmental disability, as is common? If the answer is yes, they call a crisis intervention officer or CIT. And if the answer is no, then they deal with the situation and consult the appropriate expert. The other path is an officer observing a violation, in which case, if an officer sees suspicious activity, they stop the other party, identify themselves, and give the other party a reason for stopping them. They then ask the other party for a justification for their behavior. And then, is that justification a sufficient reason for you to excuse their behavior? If the answer is yes, you have to wonder if their justification was due to your personal bias, i.e. race, gender, or socioeconomic status. If the answer is no, you think that the police officer thanks them and leaves the premises. And if the answer is yes, the police officer still thanks them and leaves the premises, but they must then reflect on their personal bias. How can they be more impartial? If their justification is not a sufficient reason for you to excuse their behavior, then you ask for their driver's license, vehicle registration, and proof of insurance. And then you consider the violation and issue a level of enforcement that will stop or prohibit the behavior in the future. For example, if someone is speeding and has no reason asked for why, then appropriate action must be taken according to the police officer's discretion.
Is this process so when you're mapping a process, there's two things you can do: the current state or the future, what you want it to be. Is this what it is today or what you want it to be?
I'm sorry, this is what it is today. Ideally, we talked to the police officer and this is what he gave us. Obviously, there are things that go wrong in this process and steps that are skipped by the police officer, but this is how it should be ideally.
This is what it should be ideally. Yeah, I'm just wondering about that question. Is their justification sufficient due to their personal bias? Are they asking, is a police officer actually going through that thought process?
Yes.
Today?
Ideally, they're supposed to, but a lot of people skip that step nowadays, which is a shame.
That's good. They looks like they put some thought into how to handle these cases. Mm-hmm. Okay, good.
So this is our stakeholder analysis, and all our stakeholders agreed with their goal, roles, process, and interpersonal.
This is our SIPOC chart, and when a police officer is approaching someone or a civilian, there are two different kind of categories that you can classify this. And first category is when they approach someone on the street or they pull them over in their car. So we have a different process here, and this was the process that the police officer also outlined for us. So first, the police officer observes a violation, whether that's speeding or if they just look suspicious. And the supplier of this is the manufacturer of the car. This is a little specific, the manufacturer of the detection system, whether that's a speedometer. The inputs are, again, the speed detection system, the visual observation of the police officer, training to know whether this is suspicious behavior or not, technology, and unfortunately also bias, whether they're stopping that person because of their skin color or because they generally have a reason to. Outputs from this are civilians stop what they're doing, they pull over ideally, and this leads to some kind of confrontation. This also can lead to nervousness from the civilian, as we've all faced. We kind of get nervous around police officers, but it is inevitable. And the customers are, again, throughout the whole process, both the police and the civilian. After that, the officer identifies himself and gives the other party.
So, Sadhvi, sorry to interrupt, but in the interest of the time, we'll just scan through it and then we'll move on to the.
Sure, I can just read each part. Like, I'll just read the process really quickly. And after that, they ask the party for justification, and then they ask for driver's license registration. We've all experienced that. And then they consider the violation and either give them a warning, a consequence, a paid consequence, whatever it is.
Okay, so our next IPOC chart is for when someone calls in, which is one of the other two types. Okay, so ideally the police officer or the police department receives a call, and then they send a group of people to the site and gather as much information on the way there. They ask questions to the citizens both in transit and at the site. And depending on the case, they might call the CITs who go through specialized training. And ideally the crisis gets solved. And if there is a mentally ill person, they get the help they need.
Coming to for the project benefits, we have fewer uses of excessive force by police officers and fewer civilians will be unnecessarily unharmed. There will be fewer deaths as a result of police brutality, and trust between police and civilians will increase. Police will be better equipped to deal with certain scenarios, and less money will be spent on lawyers. Overall, there will be a lower cost for the police officers and the civilians. This will save taxpayers and the police department up to $2 million.
This is our Gantt chart for the measure phase, and we did all of these steps as a team.
Next, we have our data collection plan. And as far as data collecting, it was a little bit unconventional compared to the other projects because a lot of this data is already available online and we can't physically collect it. We were able to access it through the police officer and through other sources. We were able to access force incidents by race, force incidents by gender. This is per year, also not monthly. Complaints from the police, from the civilians. And this is complaints usually kind of indicate excessive force because that's where cases are brought up. Officer-involved shootings also, and we said all this was kind of the same, and that we got the source from the police department. We interviewed the police officer to get this, and we collected it as a team, and it was pretty much from 2 years, except for complaints, which is only 1 year. As far as KPIVs and KPOVs, the force incidents by race and force incidents by gender, we said were KPIVs because they affect the excessive force, and they're kind of the first thing that you think about when the police officer applies excessive force. And complaints and shootings come out of that excessive force, or the KPOVs. Sampling size, we did find a sample size, but it isn't super applicable to our project because this data is already available, and it's a very specific sample, so sample size doesn't make too much sense for this.
They actually, you may not need a sample if you have the whole population. This data is actually available?
I'm not sure if it's available online, but we were able to get it. I don't think it is available online because we searched a lot to find it, but we were able to get it after we interviewed the police officer.
But if it's available, they'll probably have it for whatever period of time you're looking at. So you don't need a sample, you'll have the whole population.
Right.
So since we didn't have any monthly data, we had to create this mock data by splitting the yearly data into months. And we made it so in the summer there's a higher trend with cases, because that's what we thought, like in the summer months there would be more cases and more force. And the average for 2018 was 35 per month, and the average for 2019 was 44 per month.
For our mock data goal statement, we want to reduce the number of cases per month in 2018 and 2019 by 60%, being 14 cases for 2018 and 17 for 2019.
Hold on. So you would reduce the cases going forward, right? Why would you guys say reduce the cases for 2018 and 2019?
The wording on this isn't exactly correct. We just used that specific data. We assumed the trend would continue. And either increase or it would stay the same. So we just used these numbers as, so later on in our next slides, we show 2021 and 2022 as our years, but we use these as like baseline numbers for the next
So,
2 years.
Quick question. You guys have the yearly numbers, right?
Mm-hmm.
For 2018 and 2019?
Yeah.
So can you show me what that 2018 and 2019 yearly number is?
Yeah, it's these totals right here. We just made sure that our numbers added up to those totals, to those correct totals.
Okay.
Now we have our probability plot for 2018, and we just plotted this again to predict our the circumstances for 2021 and 2022. And again, our data was normal. As you can see, the points pretty much fall along that line of best fit. And our mean is still pretty high, though 34.67 is relatively high. If that's the amount of excessive or forced cases per month. And that is our plot.
Okay, so this is our IMR chart for 2018, and as you can see, the data set is in control and all of the data points fall between the UCL and the LCL.
So this is our process capability report for 2018. Our USL was 14 and our CPK was negative 1.36, which is less than 1.2.
This was monthly?
This is monthly?
Monthly average?
Yeah, it's monthly.
Okay.
So you guys said this was the mock data, right? All
Correct.
of this shown?
Correct.
Okay.
Yeah.
All right.
Where is your ppm values on that?
I believe it's cropped. We don't have the ppm values on here, but it was around 99.9, I think, percent.
Okay. What is that telling us?
For this specific case, I'm not sure unless someone else wants to jump in.
I mean, what is the ppm value telling us if it is 99.9 or 99.8? What is that number telling us?
I'm not exactly sure unless someone else knows.
Okay, continue.
And then we have our 2018 monthly data plotted right here. This is kind of skewed to the left, as you can see, and there's it's unimodal because there's one peak right there. It is our mean and median we kind of went over. There was no mode, obviously, because the numbers didn't repeat. And then we have our spread, our range, standard deviation, interquartile range, and our numbers right there. I don't think this is too significant on why there was a peak right here because these are just, again, numbers and it's attribute data. So we can't really evaluate too much, but for months, as far as the trend, we saw a higher trend in summer because, again, there's higher crime usually in summer.
Go back, please. Why are you guys indicating median, mode, and interquartile range and standard deviation?
I saw under the guidelines that we should include central tendency and spread, so we just included these as comparison values for 2019, which we'll get to next.
Okay.
Moving on to our probability plot of 2019, the trend is fairly similar to the 2018's plot. However, the mean is significantly higher at 43.33 cases per month, showing an increase of cases between the years. The data is normal as the p-value is greater than 0.05 at 0.763, and the standard deviation is 9.442.
Question. What is that standard deviation telling us?
It's the difference of all the points from the mean, or the variation from the mean.
Mm-hmm. So what is that in language that Jordan can understand?
Sure. So as far as our mean, our average is 43, which is the average number of monthly cases. So the first standard deviation is 9. That's pretty high, relatively, meaning that there's some cases some months it was a lot lower, some months it was a lot higher, and there is quite a bit of variation throughout the months.
Is it a lot higher and a lot lower?
I feel like relatively it is, because 9 might seem like an insignificant number, but it's also 9 lives, 9 people that are severely affected by this. And these numbers stand for people and not exactly just, I think they have more value.
Okay, good.
Okay, so this is our IMR chart for 2019. Again, the data is in control. All of the data points fall between the UCL and LCL, though there are a few points that get scarily close.
This is our process capability report for 2019. Our USL was 17 and our CPK was negative 4.7, which again, it was less than 1.3.
Just to explain this a little bit, our UCL was 17 because, as you previously remember, we wanted to decrease it by 60%, 70%, and our UCL was 17 because that was the highest we wanted to be throughout data. We don't want it to be any higher than 17, so that was our upper spec limit. And then this is just for comparison from the last slide. As you can see, our mean is much higher, and our median is also much higher. Our range and standard deviation are pretty close, meaning that there's not that much variation there. There are 2 peaks, so it is bimodal, and it's skewed to the left, similarly to the last 2018.
Yeah, I mean, once you guys know that your data is normal, you guys don't care about median and mode and range and interquartile range, actually. I mean, and the shape, is it really bimodal? If it is bimodal, your data wouldn't be normal, actually.
I thought it's bimodal because there's 2 peaks right there at 35 and 45.
No, that's not bimodal, actually.
Okay.
And it is not skewed to the left, actually, because if your data is skewed to the left, most likely your data is not normal, and you would use the median in that case, right? You shouldn't be using the mean.
Okay.
Okay, so please update those in the presentation as we go forward.
Sure.
Our analyze phase was entirely worked on as a team for the KPIVs, FOVs, and screening tools.
Okay, so our FOVs, or families of variation, they're used to determine the source of where most of the variation is originating. So our top 2 are race and gender, both of which have a big correlation and are KPIV. After that, we have the experience level of the officer and the criminal background of civilian.
This is our multivariate chart for cases for the force by race. And here we can see that most of the cases were directed towards the Black people. Like it's like 360 like cases.
So Tanish, could you go back? And I mean, multivariate chart is multivariables, right?
Yeah.
And it is only one variable against the output. So really, I mean, I'm trying to understand, why did you guys use a multivariate as opposed to a simple XY chart? Now, if you said multivariate chart for cases of force by race, by gender, and by experience level of the officer, then the multivariate chart actually starts to create a good picture.
We also had multivariables because we had 2018 and 2019 data, and we couldn't combine that into one column. So we had both, that's not multivariables, but we did have 2018 and also 2019 in one plot.
Did you guys
Variables.
include? Go ahead.
No, I was going to say the year isn't. That's just looking at data over time, but the variable's the same. Go ahead.
Yeah. So please, if I can request, right, please rerun the multivariate chart by including a few more variables.
Okay.
Because you guys have the data for gender and the experience level.
We don't have experience level. We do have gender though.
Yeah, then include the gender. And to the point that Lucas made from a time frame standpoint, you can compare it between 2018 and 2019, right? So 2018, 2019, race and gender, 2019, race and gender, and see what that is telling you guys. And what would be the point that you would actually make out from the multivariate chart?
In general, the way that we didn't do it is like which variable has the biggest impact and which variable we should target.
In which of these cases, right? So by year, by race, and by gender, which of those scenarios is giving you the least amount of cases or the highest amount of cases, right? Least amount of cases for lessons learned, highest amount of cases to resolve something. Okay.
Is that data real?
It is.
Is it really that skewed to black?
Yeah, unfortunately.
So this is your multivariate chart. Go ahead.
Now, Lucas, you bring up a good point. Would it be worthwhile to see the population by percentage? Because if there are more blacks in the city, then obviously it doesn't look skewed actually. Because if 90% of the population is blacks and 10% is the rest of them, then obviously the number of cases would be showing against blacks actually.
So your output there needs to be normalized by the number of people that you're like by population as or whatever isn't pertinent, because as Suresh said, if there's more black people in the sample, then it's going to look like that's the biggest factor, which it could be, but you just want to verify what it is. Those numbers are so much, they're kind of troublingly high. Go back to that again. I mean, Asian is 0, Hispanic is 30 something, white is 60, and black is over 300. Wow. Yeah. That's
Yeah, I think that there is a little bit of work that if I can request, as Lucas was also indicating, to do some work related to this multivariate, but also to normalize, as Lucas was indicating, based on the population. That numbers, you can get it pretty easy. By race, what is the population in Raleigh?
We'll keep that in mind. Thank you. Anish, you can go, I think.
So this is your multivariate chart for gender, and as you can see here, that males, there's more like cases towards males than female.
Okay.
And this is a parity chart for race, and again we can see that the black people got targeted more. I think it's like 71.6%.
Now you have our fishbone diagram. So we decided to include race and gender, but also a couple of other causes that we didn't really have statistics or data for. So we also did lack of accountability among the police department, police stress, which was a big thing that we talked about with the deputy chief, inadequate training for nonviolent situations. So more focusing on like combat training, and then racial profiling, as we talked about before, and also underfunding for nonviolent officials like domestic workers and psychologists and even CITs who can come on site and de-escalate the situation without there being a police officer there. I don't want to go too into depth with this because I think we're running out of time, but you can also just read any of the different causes, the buckets that we set for the fishbone diagram.
Going back to Suresh, your point of normalizing, would it make sense for them to measure the proportion of cases where force was used divided by the proportion? So it's the number of cases divided by the number of encounters or situations where the call was, the call divided by the so I went to 100 calls for Black people, and I had 60 cases, versus I went to 200 calls for white people and I only had 40 cases or something like that. I wonder if they could divide those two numbers to get the metric.
Yeah.
Okay, so next is our C&E diagram. Our first two are race and gender respectively, since those were the ones we had the most data on. Our number 3 is police stress, because again, that was a huge thing we focused on with the police officer. Our number 4 is inadequate training for nonviolent situations. Our number 5 is underfunding of nonviolent officials, AKA psychologists, CIT, child protective services, and social workers in general. And 6 is lack of accountability.
And lack of accountability varies a lot from area to area, because some places practice police impunity where they are disregarded from the law, and some places don't. So it really just depends on the area and just the laws that they have in place.
One comment for everybody: try, when you come up, not just this team but other teams, when you're looking at causes, make sure you don't imply the solution in the cause, because that can lead you down a path of bias. So when you're saying inadequate training for nonviolent situations, the cause of that, you're almost saying the solution. So you need training. So the cause is probably more likely to be they don't know how to handle, they don't have the ability to handle a situation non-violently or something like that. Just try not to put the solution in the cause. That's for everybody, all the teams.
Okay, so this is our 5 whys for race, and our remaining question was, why are most of the police force cases directed towards African Americans? When we tried to answer that question, we got to bias among some police officers. Trying to answer that led us to personality issues / possible history of aggression, which led to stress from their job / family life, which led to possible family history of racism.
Did Officer Jordan validate this?
He helped us with this process a little bit, yes, in the beginning.
I am a little troubled. I'm not questioning the validity, but I'm a little troubled by how the 5 whys is indicating family history of racism, which I'm not, it doesn't sink into my mind actually.
It could either be like a family history of racism or just ingrained bias. Like if you look at the news, there's like, if you look at like a white person terrorist and like a Black person terrorist, the Black person terrorist is like dehumanized so much more than the white person terrorist. So it's also just like ingrained bias from like society in general.
Okay. Yeah, because I mean, as we are sharing this outside, I want to be cognizant of the fact that unless it is validated or unless there is strong data to support it, I wouldn't want to put these kind of things out. Because I am actually going to share these presentations outside, but it's making me think now actually, because I really am biased among police officers. Don't know. how we are saying there is bias among police officers. What's the evidence that indicates as such? And then personal issues and history of aggression. And if the officer said that, yeah, there is history of aggression and they see number of complaints or number of cases against the officer. But I think when we saw the data, that didn't give us this kind of outcome. But again, we can catch up later on this. Continue, please. I didn't want to slow you guys down.
Okay, so our 5 whys for gender, our main question for that was, why are most of the police force cases directed towards males? Our main answer for this was males are seen as more dangerous. And when we tried to answer that, we got to stereotypes regarding males, which led us to personality issues / possible history of aggression, which again led us to possible stress from their job or family life.
So this is their Gantt chart for Improve. Again, we worked on this as a team.
So what is our KPIV? Our KPIV is police stress, and our solution for that is to hire mental workers for police officers. And police stress was a common factor for all the problems. Will this be implemented? Yes, it will. And all the stakeholders are bought off. And this should be implemented by January 1st, 2021.
Now, is this what Officer Jordan indicated?
Yeah, he felt really strongly about this topic, actually.
Okay.
We need to know and make sure that hiring mental health workers for police officers will work towards lowering police brutality cases. So we looked into a study that was done with 65 psychologists who analyzed the behaviors of police officers via the National Institute of Justice. The psychologists held interviews with the police department, and it became clear that history of aggression was the leading cause of excessive force. In another study, it was asked to recommend ways departments can help reduce use of excessive force, and psychologists cited the following. As you can see, here it becomes clear that improving training will help reduce the use of excessive force, as it reached nearly 60%.
Training. What training? What type of training are they indicating? Because that's a very broad brush, actually.
This was like the way training was ratioed between combat training and civilian training.
Mm.
In identifying excessive force, the psychologists were asked for the best methods of identifying officers prone to excessive force, and they said the following. Through this, we noticed that monitoring was the best method to identifying officers prone to excessive force. Additionally, psychologists were asked about their interventions with respect to use of excessive force. From this, we can see that most psychologists, near 80%, counseled officers already charged with excessive force, while not so many, 20%, monitored behavior for signs of excessive force. This is a problem because psychologists said that monitoring was the best method. So switching this chart around would be ideal to reducing police brutality cases.
Okay, so this is our new mock data, or what we predict will happen in the future. This is like our ideal after our plan is implemented.
So this is our new process map. So it's just a basic process map. So after a police officer arrives at work, every 2 weeks they'll attend a session with the police psychologist, as they call them, and the police psychologist will ask questions like, how are you doing today? What is the biggest stressor about your job? What is the biggest stressor in your family life? And just basic questions like this, so that both the psychologist can get information about the police officer and the police officer can also have a person to vent to, express their feelings with, which is something that we also think is a really important issue, and also the deputy chief agreed with us on that. And after this, they would report the answers and data to higher officials, and this could later on be collected to see the effect on this on excessive force, which we'll get into in just a bit.
So this is our summary report for 2022 for mock data, and our mean was 31.6, and this was reduced from when we look at 2018 and 2019. So this is our Gantt chart for control, and we did most of this as a team.
So this is our control plan that we have in place. So $75,230 is around the average salary for a police psychologist, and we just factored this in. We want to have at least 6 psychologists for the around 800 officers they have at the Raleigh Police Department, and we calculated how much this number would be that they'd be spending per year. To start the job process now, they can hire people around January 2021, and about every 3 months, we want to have feedback from both the police and psychologists to see how effective this process is. And December 1st, 2021, we're going to have this last check-in to see, is it working? And we'll also have excessive force and just force in general data cases then that we can compare to from 2018 and 2019. And although this cost might seem like a lot upfront, it is saving them millions of dollars, since one police brutality case can cost them upwards of $2 million because of lawyers suing them and just public media and that kind of feedback that they can get and backlash that they can get. We also want to make sure that there's at least 3 psychologists present at the station every day, so that police officers can go to them anytime when they want to vent or just talk to them about what's stressing them out.
So
Go ahead, finish up.
So how do we make sure the process doesn't revert back? Every trimester or 4 months, there will be data on excessive force collected and analyzed to see if it is increasing as high. The psychologists will be asked to submit a comprehensive report every trimester about their analysis regarding police officers. A bi-weekly 30-minute check-in will be required for all police officers with at least 1 psychologist.
This process will have its benefits as due to knowing that the police department is getting mental help, the public will feel a lot safer. And this will decrease the stigma around mental health and asking for help. Through this, millions of dollars will be saved that are spent on police brutality cases by taxpayers and the police department.
This is our IMR chart just to show the difference between 2019 and 2020 and 2021, 2022. Lastly, we just want to say this is in honor of all the 4 males that we know that have passed away due to police brutality in Raleigh specifically, and we hope that justice can be served to them.
Finally, we'd like to thank everyone, Suresh Uncle for helping us, Deputy Chief Todd Jordan for being super helpful, Mr. Lucas for coming here to judge us today, and just everyone who's ever helped us and supported us, and yeah.
Good job overall. I think you guys had a good topic here, a good, something that definitely needs to be addressed. I think when you think about it, make sure your goals are realistic. You're trying to, this is the tough one to fix and trying to reduce it, but I think you had 60%. It's probably not realistic. That's one thing to think about. I want to ask you one question. You think your solutions, you identified that Black people are getting more use of force than any other race. Do your solutions address that at all? Is there anything specific that could be done to address the cause of Black people getting more harassed.
Yeah. I think with the psychologist sessions, we hope that if there's any, like I think a lot of times people are very vulnerable with their therapist or psychologist. If there are any cases or any even symptoms of racism or just aggression, we hope the psychologist would report that to the higher officials and they would take care of that. Because if they can eliminate the police officers that are expressing these kind of behaviors and can be a problem for the police department, I think they're kind of nipping the bud before it can even grow.
So one other thing, that's a good answer, is you will find that there are other countries, other cities, other places that don't have as much of an issue. And a good idea is to benchmark and see what they're doing. You may want to Google Camden, New Jersey. They went through an effort where they reorganized the whole police department, and the police officers are now part of the community, and they do a lot of things that interact with the people and ask them questions before they come and do their work. And just look that up. So that's something to think about on something like this. That's a very difficult one to fix, is what are other people, other areas doing that don't have this problem. Thank you. Good job overall. Great.
Thank you, guys. I would request run that multivariate chart and see what that is telling us. And please do normalize it based on the population in the city by race versus the number of cases against that particular race. And let's see what that tells us.
Sure.
Thank you, guys. Good job.
Can my group go next?
Please. I think this is the last one, I believe.
Yeah, this is the last group, Andy.
Yeah.
Good evening, everyone. My name is Ananya Nakalapudi.
My name is Apurva Nakalapudi.
My name is Himavarshini Petty.
My name is Punitha Malarapu. And our project is how to stay active during COVID-19.
Before starting our project, we came up with the different factors that were necessary in order for our project to succeed. We decided that they were commitment of team members and surveyors, honesty and accuracy from the people who are providing data, providing details or change in habits due to COVID-19, participants understanding the importance of staying active and fit, good communication between team members, and mentoring and guidance from our coach. Now moving on to the define phase. This is our project charter. Our problem statement was, due to COVID-19, the physical activity among people has decreased, and they are forced to stay indoors. Per a Times article, Americans became 32% less active since COVID-19 started. Our goal statement was to make sure citizens maintain a healthy lifestyle while the gyms are closed and they are forced to stay indoors. Our main metric was hours. To be more specific, hours per day. Our main metric baseline was 1 hour and 30 minutes per day, and our target setting was to increase the daily physical activity amount by at least 30%, which is about 20 minutes. Next is our process map. To sum it up, we started the project by creating a survey that would be sent out to 20 people as a way of collecting our data. We later decided to change our sample size from 20 to 30 people in order to get more results. Once receiving the survey data, we analyzed the different active lifestyle patterns that we found. We then came up with new strategies to increase people's motivation in order to make sure that they exercise for a longer period of time each day. To test our strategies, we asked 10 people from our survey of different age groups to exercise for 3 days while implementing our strategies and record their daily physical activity time. We then compared their average physical activity time before the new strategies and their average physical activity time after implementing the new strategies in order to see how much change is made. This is our SIPOC map. Our suppliers were the Carytown residents and gym or club members. The inputs that we needed were the changes that have occurred in residents' daily physical lifestyle and the improvements or cautions residents would like to see from businesses. Our process is covered in the process map that I talked about earlier, which is the daily physical activity time. Our main output was increased motivation and physical activity time of Carytown residents. Lastly, our customers were gym and sports club members, as well as gym and sports club owners. The last part of our define phase was the stakeholder analysis. Our stakeholders were everyday citizens and gym owners. Our areas of importance were citizens' physical activity, as well as businesses being able to attract more customers. Our main impact was that people would be able to go back to their everyday workout routines. Lastly, our engagement level was to see how businesses can implement the ideas and changes that are provided by the residents.
Okay, now for our measure phase. This was all of our data that we had collected. The overall average time that most people were active for was at least 1 hour a day. All of our data was variable and independent. We collected our data through a Google form which asked how much time a day people were active, what they did to be active, and how their activeness changed from before quarantine started to the current time. We had 3 outliers in our data. Our first 2 outliers were Nikhil and Bindu, as they had not been active at all, and our third outlier was Haley, as she had been active for 2 hours and 30 minutes every day. The main team members reached out to 30 different people to collect this data. We have only listed 20 people here for the sake of space. However, those data points weren't much different. As you can see here, the data was normal and not too much of a variation, as our p-value was 0.08. On the right side, you can see our IMR chart. The green line represents the mean value, and the 2 red lines represent the upper and lower control limits. You can also see that the process variation is in control. As you can see from this chart, our process was capable of meeting our standards. Our PP was 0.54, and our PPK value was 0.32.
Can you go back, please? One more. The data, was it captured or expressed in terms of minutes or hours?
It was in terms of minutes.
Okay. And so there were actually a few people that had the same amount of minutes in the data set?
Yes.
Okay.
Okay. So here are our descriptive data statistics. For our central tendency, our mean was 1 hour and 7.5 minutes. Our median was 1 hour, and our mode was 1 hour. On the right side, for the spread and shape, we have a slightly skewed right shape.
Data you collected was in hours and minutes?
Yes.
So you asked, I told you how long I exercised for. I gave you a number, 1 hour and 10 minutes, something like that. Is that?
Yeah.
So how come you didn't describe the median in minutes instead of an hour?
We put them into hours because those were more easier for someone to understand instead of like maybe 67 minutes. So just to be easier for other people to read it better.
Okay.
But we did our data through the minutes. Okay, for the summary of the measure phase, the normality, the data was normal as per conducted through the normality test. Our process was also stable. And for the descriptive stats, our IQR was 30 minutes. Our standard deviation was approximately 34.4, and our modality was unimodal.
Can you go back to the actual data for a second? Go back, please. Go back to your Google form. Yeah. Can you go back one more, please? Okay. Okay.
Now moving on to the analyze phase. In the analyze phase, the first thing we did was look at what's leading up to a decreased amount of physical activity due to COVID-19. When creating our fishbone diagram, we made 6 categories that each factor would go into. We found that when people think they don't have enough time, they convince themselves not to exercise. When people are lazy, they don't find reasons to exercise, and when they find out that they can't go out, they think they can't exercise, and so on. Coming to our C&D diagram, our top two most important process inputs are exercise videos and physical appearance. The bottom two were ideas and communication. Everyone had a decreased physical activity because gyms are closed, which equals less equipment. Everyone lost their daily routine, so they had no plans, and since there really wasn't much good news, there was a lack of motivation, and in the end, everyone was lazy. The last part of our analyze phase was our 5 whys. The very first why was decreased daily physical activity. That led to a lack of equipment. The third why was that many people do not have a plan or routine. No plan or routine means that people won't have any motivation or willpower. Lastly, all of these factors led to laziness and not knowing what to do.
Next is our improve phase. This is how our future process map will look like. First, research new strategies that will help improve daily physical activity time. Then create physical activity log and ask 10 members to record their daily physical activity time while implementing our strategies. Then analyze the newly acquired data from physical activity logs. Then have results increase to the amount we aim for. If not, we move forward. If not, we go back to our first step. If yes, then we move forward. Then project team members share survey data with businesses on changes they can make to bring in more customers. Then businesses implement new ideas that are given by project team members. Then customers can go to gyms, sports clubs while staying safe. Then citizens will continue to stay active whether at home or at gyms or in sports clubs. Businesses can bring in more customers.
Can you go back to your causes? So go back to one more. One more. So were you saying the major causes you guys think of why people are exercising less is they're either lazy or they're not sure what to do?
Yeah.
And then how does your solutions address that? So if I'm lazy, am I going to do all those things that you said? And then does it address the not sure what to do more than the laziness? Are you even addressing the laziness?
Yeah, we are. Our solutions, we present our solutions later on in the slides.
Okay. All right. Go ahead. Sorry.
No problem. We were able to validate our solution by gathering data on how much each person's daily physical activity has increased after they implemented our new strategies. At an average, the physical activity duration was increased by at least 50%, which was beyond our goal. For example, one of our testers, Hasita's daily exercise time went up from 1 hour every day to 1 hour and 30 minutes after she implemented our strategies. Not only did her time increase, but she informed us that she also became more motivated and excited to work out because now she had a plan and an end goal. We had our testers increase their activities through implementing these following solutions. Having a friend tag along. Having a friend tag along with us motivates us to spend more time exercising. Due to COVID-19, you may not be able to meet, but there is always the option of video calls. Having a friend tag along can also make exercising more fun. Listening to music. Listening to music can always get you pumped and motivated to exercise. It can also take your mind off of the tiredness or soreness. Keep the outcome in mind. Think about how exercising is helping your body. You may not see it right away. However, you may need to be consistent and you will definitely see results later on. Use a motivation app. Apps are a great way to motivate yourself and keep track of your daily activity. Have a plan and an end goal. If you know what you want, it is much easier to get there. Write down a plan or a timeline as well as your goal to help you be on track. Reward yourself. Having a reward is a great way to motivate yourself to stay active. There are many ways you can reward yourself. For example, your reward could be watching an extra 30 minutes of TV or a special snack. Space it out. Don't attempt to do a lot at once. You may need a break, especially at the beginning. Exercise for 5 to 10 minutes at a time and continue that process throughout the day. Free online videos. There are thousands of videos online, for example, YouTube, that can be used to guide you on many different types of physical activities. You can invest in some basic workout equipment like dumbbells or other weights and create a workout routine for yourself in the comfort of your home.
I think you guys got good solutions there, but I would go back and probably redo your causes. So I think you addressed the not knowing what to do with the videos. That makes a lot of sense. But your other solutions were really more related to, it sounds like the cause of the problem is it's not fun to exercise, or I'm just not motivated to do it. So I think your solutions address more of those causes, not the laziness.
Okay. We had our testers implement our solutions and track the activity through the use of the document presented on this slide. First, we asked our testers how long they exercised that day, what solutions they had implemented, and what type of exercise they had done. We also asked them at the end of 3 days to answer the 2 questions at the bottom. Did our solutions help you stay motivated and exercise longer? If so, explain. And are there other ways that we could have helped you stay active besides the solutions we had presented? From our newly collected data, we learned that these new strategies did in fact increase citizens' daily physical activity time. Average daily time before our strategies were implemented was 61.5 minutes, which is about an hour a day. And after the implementation of our strategies, the time increased to 97 minutes, which is 1 hour and 37 minutes. If our testers and others continue to follow our solutions throughout quarantine and once quarantine is over, businesses like gyms, sports academies, and businesses that advertise healthier lifestyles can expect an increase in income and customers.
Lastly, for our control phase. Based on the rest of the project, we came up with ways to make sure everyone stays active. We needed to make sure that everyone has access to tools that will motivate them. We need to keep talking to people to motivate them and to reach out to more people. The people who are currently doing this will spread the word, and we will try to do the same by sending messages in different ways and maybe even through social media accounts. Thank you, and make sure to stay active.
So can I request, do you guys have the after data that you guys can share?
Yeah.
So the average was 61 minutes, and out of the 30 people, how many of them were less than 60 minutes in the before data?
In our before data, we had about 10 people that were below 60 minutes.
And in the after?
In the after, everyone was above 60 minutes.
Okay, so the movement in the mean was because the people that were not exercising are now exercising, hence the move actually in terms of the average being higher. I wanted to see what the new data looks like in terms of the distribution, if you guys have done that.
We didn't do that for the after data. We didn't create any
But can you
charts
guys,
on that.
if you guys can share the after data, that would be nice. Can you guys go back to the presentation? I want to take a look at the distribution for a second.
Do you want to see our data collection plan?
No, the distribution actually. The capability analysis on the next slide. Okay, there is. And what you said was LSL is 50 minutes. 0.5, that is 50 minutes.
Yeah.
Okay. And what that is saying is there is 15% of the folks that are less than 50 minutes, right? Roughly speaking about. And 15% of 30 is 4.5 people. That's 5 people. And even if I move the bar up to 60 minutes, it wouldn't change significantly. Okay. Can you go back to the actual, one more slide? Go back one more slide, please. One more slide. Go to the IMR chart. Yeah, that one right there. This one is only showing 20 data points. The IMR is showing 20 data points, and is the probability plot is also showing only 20 data points. So based on that data, you have 3 people that are less than 60 minutes. Right? Maybe you forgot to add the other 10 data points to run it. Or maybe you guys picked the wrong graph actually. When I say wrong graph, maybe you picked the old graph actually to put it in here. That's okay. And then any reason why you chose only one root cause as opposed to maybe some other root causes?
We wanted to focus on the main root cause, whereas doing a bunch of different ones and not having real solutions to all of them.
Mm-hmm. Okay. Now, why do you guys think that these people adhere to those strategies? Because those strategies are all out there actually, right? Anybody can access those. YouTube's Getting Motivated, that information is available in terms of you need to be motivated to do it. You need to set a schedule. You need to create a plan. All of that information is available out there. And I'm curious in terms of why did this population or this sample set was quickly able to adapt to those? Because I think that is the key for this project, is what made that stick, that they were able to stick to those things.
Most of our people that we had test our solutions, they just like go on runs, or they didn't really have like a specific way they were doing it.
Mm-hmm.
They just like go on runs or like have this like small workout routine where they do like a few sit-ups.
Okay. So would it be fair to say then the folks that were in the population of the 20 data set, 90% of them, or 85, 90% of them were already doing some significant activity of work?
Yeah, so as we said, before COVID-19, many of these people were already active, but then when quarantine came along, they stopped. So we kind of had to remind them what they can still be doing, even during quarantine.
And your after data set is for how long?
For 3 days.
3 days, okay. Okay, good start. Okay, good. Lucas?
Yeah, I really kind of the same thing you guys were saying. I think it's a good project. Just the causes, as I was saying before, really understanding the causes of why people might not want to exercise as much is really the key. And I think you just need to dig into that a little bit more. I don't know if you asked them, I couldn't tell if you had interviewed them and they started to give you some analysis of why they really didn't want to exercise as much. So I think just making sure you really understand the causes of it and tie it into the solutions and is really the key to this one. Like Suresh said, it's hard to understand why they would necessarily want to exercise more based on that procedure that you wrote. So.
Okay. I think that brings us to all the presentations being done. And I believe Shiva wanted to say a few words, and then we'll close it out after that. And then Lucas, I would request probably a few words from you too, actually, before we close it out.
Hi, everyone.
Yeah, Shiva, you can go ahead.
Yeah. Hi, everyone. Hello, all. This is Shiva Giredi. I'm the president of TUTA, Triangle India Telugu Association. Thank you all for joining today's global presentation. I sincerely thank VSTEP team, Suresh Velanki garu, and other VSTEP team members. And I also thank Lucas for spending a longer time on this weekend. I know it is very tough. Thanks for being a judge for these presentations. I'd like to thank our TUTA Board of Governors Chairman, Rajiv Reddy Gongidi Garu, and entire TUTA board. Special thanks to our Srinivas Dandepalli, he is our TUTA Bhavita Director, who managed entire this 8 to 10 weeks Blue Belt presentation, Blue Belt program. And I also thank Ajay Anugu, our web and social media editor, who helped with managing, connecting the dots every now and then. Lean Six Sigma method release on a collaboration team effort to improve the performance by systematically improving the waste and reducing the variation. Six Sigma is a quality control methodology and uses a data-driven review to limit mistakes and defects in the process. All the participants did exceptionally well with their presentations and hope you learned a lot. And thanks a lot to VStrive team for helping everyone in improving their process learning. I even completed my Lean Six Sigma yellow belt and currently doing my green belt with my work. But I think the TUTA and VStrive blue belt program is much more challenging and tough. Whoever participated in this program is really lucky to get the in-depth knowledge from the great mentors on Lean Six Sigma process. I promise this program really helps you to shape up your career. Thank you all for joining, and please stay tuned for TUTA's next exciting programs. Thanks, and Suresh Garu, you can continue.
Lucas.
Yeah, I want to say overall, I'm very impressed with the work that you guys are doing here. As I said, I've mentored hundreds of people. I've been involved in this stuff way too long. Years that I can count now. So I know how difficult some of this is for people that are already in the industry and have been working for years. The analysis, the rigor that a lot of you have put is really incredible. I mean, this is probably just the first project that you've done. If you were to do 2 or 3 more of these, you would be very good. And so I would hire you to do the work for me because you guys are that good. So good job, Suresh, and everyone else that has put this effort forward. And it's like I said, I'm very impressed. Great job.
Thank you, Mr. Shiva. Thank you, Lucas. Thank you, Srinivas, and the team of TUTA. But I am excited, but also at the same time disappointed because the program is coming to an end, and I don't get to harass anymore any of the youngsters actually, like I did for the last 12 weeks. So you guys have done an amazing job and put in a significant amount of effort into what you guys have shown here today. By all means, I am amazed at the amount of effort that you guys have put in. Yeah, there are minor corrections here and there. Don't get discouraged by that. That is part of life. Even in professional life, there is always these kind of corrections that happen. But the passion with which you guys have completed the projects is amazing. The amount of effort that you guys have put in is amazing. The type of projects that you have chosen is out of the park for me. Because when I go through the projects related to whether it is reducing the COVID-19 cases, whether it is increasing the pet adoption rate, whether it is reducing the time for the homes being on market, whether it is reducing the police brutality or increasing the physical activity. Think about these. These are all social issues. At this age, you guys are looking at those social issues and trying to solve those problems. That is amazing. At your age, I was climbing trees and having fun. Right? It's amazing to see you guys tackle on these kind of problems. I'm amazed at the selection of those projects. I don't know what is going on in your brains actually, that you guys have chosen these amazing topics to be able to go and address them and handle them. Pat yourself, pat your back, pat yourself. Go tell your parents that, you know, we did something amazing. Have you guys done something like this? Don't tell me to do this or that. Show me that you have done this before you tell me to do something else. That good. You guys are that good in terms of what you guys have done. Keep that up. Always think about the social causes and how you can help others, how you can contribute to the success of others or the community around you. And hope to see each one of you be leaders in your own right, in your own passion related areas. So that Lucas and I can say, oh, we know them.
We're not as good as you guys. We're just old.
That's it. Say kudos, be proud of yourself. That's it from my side. So I do request some of you guys, based on the feedback that was given, please rectify your presentations and send them back. The next steps are, we are going to take those presentations and I'm going to find avenues for each one of you, each one of these projects. If I can take the police brutality project and find an avenue to present it in front of some police officers, let me try and see if I can find a platform for that. Some of you that have worked on COVID-19 cases, or some of you that have worked on pet adoption, or some of the other things, let me find an avenue to see where we can present this, right? In the past, we did this. So let me find that, but to be able to do that, we need to rectify the presentations a little bit. And then I'm also going to see if I can submit it to i6sigma.com as a paper, a general paper, so that we can have all of your guys' name on there as that you guys have did this body of work, and Lucas and Srinivas and others have contributed towards the success of this particular program, right? So there are a few things that are in the works, but we need a little more from you, just a little more. Please fix those things that we talked about, that Lucas shared, in terms of the things that need to be modified or updated, and then we'll take it from there, right? And Srinivas and Mr. Shiva will be in touch in terms of what are the next steps related to your certifications, right? They're planning something big. I shouldn't have said that. I let the cat out of the bag.
When do we need these like presentations?
Is a week or 2 weeks good? Is a week good, or do you guys need 2 weeks?
I think for our project, we need about 2 weeks.
2 weeks. So let's broad brush it and say in about 2 weeks, if you guys can update a little bit and send them back to me, please. And if there is any help needed in terms of fixing those projects related to the feedback that Lucas gave, please reach out to me. Lucas, again, a big thank you. I requested, I think, 2.5 hours, and I took 3.5 hours of your time.
All right,
So,
my wife's just going to kill me now, so no
yeah,
problem.
so that's
All right.
why I was going to say, please
Thank you,
communicate
everybody.
my apologies to her. Yes.
Okay.
Yeah, thank you, Lucas, for spending a lot of longer time.
Bye,
I would like to add a couple of points. Today, I felt like the kids are defending their like master's thesis. Since I come from research background, I know how it goes. So typically, if I felt that they were defending their thesis, it was like that much rigorous. So the kids did amazing job overall. Like I felt that's what. Anyway, thank you all for attending this
It was hoping a
session.
camera, I think.
Yeah. So we will get back to you for handing over certifications, and maybe we're planning some kind of ceremony. We will announce. Please stay tuned for the updates. We'll get back to you. Thank you, Lucas. Thank you, Suresh Garu, for giving us a platform to successfully finish this program. Thank you. Thank you all.
Thank you all for joining. Thank you.
Thank you.
Take care. Thank you.
Thank you.
Thank you all.